Good morning, everybody. Good morning to you, and welcome to this year's Food Active Conference, increasing access to healthier food from national policy to local action. My name is Matthew Philpott. I'm Executive Director of Health Equalities Group, and we're the public health charity that runs the Food Active programme. So welcome to today's conference. Very warm welcome to all of our delegates and our speakers for this year's Food Active Conference. We really hope that you enjoy today's event. This year's conference, we're back online this year after a successful face-to-face conference that we held in Liverpool last year, and that was to celebrate our 10th anniversary. Somewhat remarkably, we have actually had over 600 delegates register for today's conference, which has just been absolutely fantastic. I can see that we've already got nearly up to about 250 in the room, probably more to follow. So many thanks for registering for today. And a huge thanks in advance to all of today's speakers, panelists, and all of our session chairs. We really do appreciate the time and the effort to participate and plan for our annual conference this year. Thank you. So just a little bit of information about Health Equalities Group. We're a public health charity working to improve the well-being of communities across the UK. Established nearly 20 years ago now. We were established in 2005, and we're an independent voice for preventative public health, very much working around population health. Our heartland, I suppose, is the northwest of England, but we do work further afield than that as well. Working with local authorities in the main, but also other charities, NHS organisations, central government, many other stakeholders to help improve the conditions that hold back many of our communities. And many of our programmes that we work on and the projects that are addressing diet-related ill health. And in general, they will fall under our Food Active brand. Thanks. So what about Food Active? We are a programme that was launched 11 years ago now by Northwest Directors of Public Health. And that was mainly due to concerns about rising levels of obesity, both in the Northwest and further afield. We're currently commissioned by 20 of our 24 local authorities in the Northwest region. But we do also work with other regions in England and with a wider range of stakeholders. We work in many of the regions, such as the North East, the West Midlands, down in the South West, many commissions, not only from local authorities, but NHS and third sector organisations. And our core aim in Food Active is to advocate for local, regional and national action to promote healthier weight and to tackle health inequalities. And I'm going to hand over now to the Food Active programme lead, Nicola Calder, who's going to be able to give you a bit more information about Food Active and some further details on today's event. So enjoy today's conference. Many thanks.
Thanks, Matthew. Before we hand over to our excellent speakers for today's session, I just wanted to briefly provide some context for the theme of this year's conference. This is very much focusing on issues of food access and food insecurity, which we know are really pertinent and of huge importance when considering the impact this has on food-related ill health. Two significant publications just to bring to your attention, I'm sure you're aware of, but also provide further evidence of this. The Food Foundation Broken Plate Report demonstrates that the UK's food system and our food environments have led the UK into a national health crisis. And we'll be hearing more from Dr. Hannah Brinsden, Head of Policy and Advocacy at the Food Foundation shortly. The recent House of Lords Committee Recipe for Health report published last month demonstrates the gaping inequalities in unhealthy diets, obesity and diet-related disease. Almost a fifth of children live in food insecure households. And we've also seen the recent NCMP data which has shown the inequality gap in obesity levels between children from wealthy households and those from the poorest households is now more than double. So what do we mean when we talk about food access and access to healthier food? Well, this is more than just about general food availability. It's also about ensuring communities have access to adequate resources to acquire appropriate foods for a nutritious diet, and the environments within our communities offer choice and access to healthy and sustainable food. And we'll begin to explore more of this context as the programme this morning progresses. So as you'll see, we have a morning of two halves. The first session today will focus on the current food policy priorities that are emerging from the newly formed government and where these might present opportunities to increase access to healthier food, promote healthy weight and address inequalities. Our panel debate this morning will enable panellists to highlight potential gaps within the national policy framework and also consider scope to go further with bolder policies to create health enhancing environments. Session 2 will be chaired by Professor Matthew Ashton, who will provide an opportunity to share local good practice, aiming to address gaps in national policy and increase access to healthier food. And this will be shared via the Conference Hub, which has now been launched and will host all the speaker profiles and presentations from today, including the case studies presented. In addition, you'll find a number of the relevant food active resources relating to today's conference theme that will be hosted on the Hub. This includes a newly launched resource as part of our Efficacy of Intervention series, a Healthy Start, What Works Well briefing paper, which looks at opportunities to increase uptake of the scheme to eligible families. And again, we'll hear more about that as the programme progresses today. So finally, just a few housekeeping notes. Please can we encourage you all to use the question and answer function to post any questions for our speakers this morning. A recording and speaker presentations will be uploaded to the Conference Hub later today. And finally, I'd just like to welcome Chris from Nifty Fox Creative. Chris will be acting as a live scribe for today's event to create a visual representation of the discussions throughout the morning. And these visuals will be used post-conference to summarise calls to action for government and key learning and reflections at a local level. So welcome to Chris. So by way of formally opening today's conference, I'd like to now welcome Professor Christina Vogel, Director of the Centre for Food Policy and Professor of Food Policy at City St George's University of London, to offer this morning's keynote presentation on why obesity-related policies have thus far failed in the UK. So welcome and thank you, Christina.
Wonderful. Thank you very much, Nicola, for a warm welcome. Can you see my slides?
Yep. Yes, we can.
Excellent. Fantastic. So thank you very much for the invitation today. I'm truly delighted to have been invited and to kickstart today's program. My title of my presentation is to explore a little bit around why in the UK we failed with our food policies to achieve population diet, a healthy population diet, and really address obesity. And there's many challenges that are created and also that our current food system faces, and Nicola outlined some of them already in her introduction. So we've got these range of, many of you will have seen this food systems diagram that came from the Centre for Food Policy, and you'll be familiar with this. But really, I wanted to use this as just a bit of a highlight of some of the statistics and some of the reasons why our food system is currently failing us, and why food policies haven't actually achieved that their success in achieving population diet and addressing obesity. So, of course, we've heard that food insecurity remains high, with around 18% of families currently reporting that they have experienced food insecurity, and that 18% is families with children, which is, of course, a great concern. Slightly lower percentages among families without children, but still huge numbers of families that are experiencing food insecurity. We also heard about the increasing inequalities in children experience obesity, and that this has continued to grow. This graph here really shows you how that's continued to widen over the last 15 years, with currently a 17% gap between children living in the most deprived areas of the UK versus those living in the most affluent areas. So again, a real failure of our food policies there. We also know from some of the excellent work done by the Food Foundation, from their Broken Plate, that healthy food costs more than double the cost of unhealthy food. And these are some analyses, and the benchmark here is our nutrient profile model that is really used to assess healthy and unhealthy food. So again, a real barrier that our food policies haven't been able to overcome. And of course, we can't forget net zero and the the food systems and sustainability issues that our current food system faces as well, where approximately a third of all territorial UK greenhouse gas emissions come from our food systems in the UK. And this figure comes from a recent report by IGD, where they're really trying to align industry on a roadmap for net zero, which is great. But diet's not featured very clearly in this report, so lots of work to do there. There's also a whole range of other barriers and areas in which our food system are not functioning properly, and areas for food policy such as workforce exploitation, unequal distribution of finance across the food system, and also biodiversity loss. So really this gives us a really important opportunity to rethink food policy, and it's important that our food policy is used to improve nutrition, health, protect the planet, and contribute to economic and social prosperity from which everyone can benefit. And this is really aligned with the work that we undertake at our Centre for Food Policy, where our vision really is to inform policy and practice that redesigns food systems so that they can be fairer, healthier, more sustainable and more resilient. And we do this through 4 key areas. We generate evidence, we provide the space for debate through our Food Thinkers program, our annual symposium and other areas for debate. We then have an impact on policy and practice, and importantly, we educate others through our MSc in food policy, and also CPD modules part of that MSc, and our PhD programs to really build that nexus and the alumni, many of which who are tuning in today. And we cannot achieve this throughout partnership and engagement and learning from lived experience. But you may be thinking, well, what do you mean by food policy? So I thought I'd give a quick definition of what we mean by food policy. And food policy are policies that concern people whose job it is anywhere across the food system. So that could be growing, moving, processing, selling, consuming, or disposing of food. Really, food policies have a key role in correcting food systems challenges. And they cover anything from public policy, so government policy that really is the focus of today's discussion and debates, but it can also be organisational guidelines or procedures or protocols that are produced by any people across or outside of government. So it's a really broad remit. But why are food policies failing then? And I'm going to today touch on, there's a huge number of reasons, but today I'm going to touch on just 4 reasons that I think are key to why food policy has failed to achieve population diet, a healthy population diet, and address obesity in the last 15 years. So the first one is that food policies are not joined up. Government efforts to really address food systems challenges in one area, so it could be in economics, for example, can often undermine food systems objectives in the other. So, for example, we might be targeting economic growth, but actually that might undermine policies that need to protect the environment or protect health. And really that is of key concern when you're looking at how you might address food policies. So we're not joined up. And of course, this is across different challenges of the food system, but it is also across within health. And that's really what I wanted to focus on with the last sort of 15 years. Where are the examples? Well, here's a great number of food policies that the government has introduced since 2007. We've got the restrictions on banning advertising of unhealthy foods and TV programs that was introduced early in 2007. Then we've had food labelling, where we've got this traffic light labelling about energy and reference intakes for certain nutrients. Then we've had school food standards that have been come in. We've got calorie reduction scheme through either reformulation or through reducing portion sizes, and that's been voluntary. We've had mandatory calorie labelling on out of home. We've had the HFSS regulations that have come in around the food regulations that are really trying to restrict marketing in food retail outlets. But even they don't actually align with our current dietary guidelines. The monitor and the measure that we're still using is based on 2004, 2005 benchmark of what we called healthiest. It hasn't been updated to consider the increased fibre need or the reduction of sugar intake. So really there's a whole range of factors here and policies that just are not joined up. They're not aligned. line, there's no nexus by which they can actually connect and achieve a sort of consensus and a collective output. And really part of that reason is because many of you will have seen this work that came out of the centre early from Kelly Parsons and Corinna Hawkes, which shows that actually policymaking in the UK is not at all joined up. Currently, there's 16 government departments that hold some level of responsibility for making food policy in the UK, and it's still very siloed. You know, DfE are largely responsible for school food standards. We've got DHSC that are responsible for various policies that have come in, but they're not joined up across the other government departments. So that still is a major issue. But of course, we've had a lot of political turmoil and political turnover. I calculated that there's 13 secretaries of state in the last 15 years, each coming in with their own political perspective and their own political persuasion and area that they want to go. So what we really are missing in joined up food approaches to food policy is a long-term vision and plan. And Nicola highlighted the House of Lords report, Recipe for Change, and actually their key primary recommendation is that we need this joined up thinking and this joined up long-term plan and approach to really avoid the piecemeal approach to policy making. Additionally, how do we achieve joined up food policy? Well, what's the practical approaches that we could take to do this? At our symposium last year, our Centre for Food Policy Symposium, we really discussed how you might achieve co-benefits and really address trade-offs head on. And what we came up with were 4 key approaches, which I'll just outline very briefly, is that we needed to be inclusive of all people across the food system. And this concept of inclusivity really allows us to identify the context and the concerns that every stakeholder across the food system has. We need to consider and challenge people's values. Economic imperative, by all means, has dominated policy making and food policy making. And really what we need to start to do is in conversations, challenge that imperative, talk about the health benefits, talk about the societal benefits and the inequalities. And often to be able to do that, we need to use strategic language. We need to use the words that we're talking about very strategically. There's some great work that we've done around why there's not more joined up thinking and discussion and action across government departments. And really what we found is that there were departments like the Department for Work and Pensions and DEFRA who just will not, they'll sort of switch off and go health. If you're talking about food or diet, then that's the Department of Health and Social Care. That's not for us to be considering. Where actually when we were talking with colleagues in DWP, they were saying if you talk about inequalities and you talk that language, then we can link up. So I think again in health, if we're wanting to spread, then we really need to think about how we can use language strategically. And of course, the 4th area, an approach that came up to really create a long-term vision and identify co-benefits and reduce trade-offs was around harnessing regional activity. And there's some excellent areas that you'll hear about in the second half of this morning's program that many of you are actively involved in on the call, where you've already been shown the active engagement and the way that food policy can be used to ban hot food takeaways, to restrict advertising at the local level. And that is really providing a leadership on what can be achieved nationally. So moving on to the second reason why food policies have failed so far in the UK is really that they've failed to address structural determinants of poor diet. And you can see here that many of the initiatives that have come in have either been voluntary or they have been focusing on the agency of an individual to make their own behaviour change. So make a sugar swap when you next swap, or use food labelling, or count on 5 a day. But the excellent work by Dolly Van Tulken and Martin White has really shown that actually these have consistently shown to fail. And some of our own lived experience research that we've done when we've been out hearing from families who are experiencing poor diet, then they tell us that it's about money, of course. It's about affordability. You know, the price of fruit and vegetables is expensive compared to biscuits, which last long and get eaten. But also there's hinders and there's factors around housing. The second quote there, I just cook quickly so I can vacate the space, is very much around a mother who was in a temporary accommodation, and she had to share a kitchen with a single man. And she did not trust, she didn't know the man, so she didn't want her children spending time or being exposed to that gentleman. So really they relied a lot on takeaway and food that could be prepared in their meals because she didn't want to use that kitchen space. Also, there was a feeling of, why should my kids be missing out? There's an emotional need and desire to give to our children. And actually, if I can't afford for my children to learn an instrument, then if we go to have a takeout, we all enjoy that and it makes us feel good. So there's various other reasons why food choices are being made. And many of our food policies to date have failed to address those issues, those more structural issues. Having said that, that is starting to change, and we all welcome that. There's increasing evidence to show that there are more structural and environmental drivers of poor diet, and we are starting to see these come through in our food policies, as you can see the more recent policies here on the right-hand side, addressing affordability or addressing taxing unhealthy products like soft drinks. And if we look at one of the evaluation, the excellent work that came out of Cambridge, this is really shows that actually it can work. These policies, these more structural policies can work, but they don't necessarily work universally for all population groups. So we can see here that there was a reduction in intake from the most deprived girls experiencing deprivation. But when we look at boys who are experiencing deprivation, we don't see the same level of reduction. And really, this brings me to sort of the third reason why food policies fail, is that we don't consider adequately the context in which they're being implemented. And there's a huge amount that we in food policy and in public health can learn about from implementation science, where there's a much closer lens on the context within which food policies and programs are being implemented. And here's some systematic reviews that have been undertaken. And really what they show is that very few frameworks consider a systems approach or consider inequalities. And this is a real gap in work that needs to be done. And just to show sort of an example of where the context really can hinder implementation, Healthy Start is a really great example. So many of you on the call will be familiar with Healthy Start, and you'll hear more about this later in the program. But it offers a subsidy for families experiencing low income to overcome that barrier of the high cost of fruit and veg and milk. And over the course of a child's life, the monetary value can be significant. Over £1,200 can be attributed to that over the course of that child's life if they took it from 10 weeks of pregnancy through to when they turned 4. But at the moment, there's nowhere near reaching that 75% target uptake. And there's lots of work to be done there to understand the rationale and the reason for that. And we're doing some work evaluating this Healthy Start scheme at a national and sort of local level at the Centre for Food Policy. And what we found is the new digital card has made a significant difference. And many families say the digital card now is much better to use. I can use it really well, and it's overcome a lot of barriers in the shop. However, and it does make a difference to families' diet. So many families have told us that their child's diet has actually improved, and that there's a detrimental impact if Healthy Start is taken away. But there are also other context factors, such as some families have told us that they don't think that Healthy Start is for them. They think it's a white people's thing, or there's cultural barriers to joining up. So again, we need to better understand how we might need to deliver interventions differently to better understand the context so that they can be equitable in their effectiveness. And also sort of misunderstanding or confusion around how it might affect other benefits or more valuable services or benefits that are being claimed. We wanted to take some of this work and then really apply it in a pre-implementation stage. So many of you will be familiar with the food promotions and placement regulations that came in 2021. And these are very much, again, a national policy, but is implemented at the local level. So in-scope stores are the large stores, so more than 50 employees, or a store size of greater than 2,000 square feet. And there's 3 different areas in the store in which are affected: end of aisles, front of store, and the checkouts. It applies the HFSS nutrient profile model and applies to 13 different categories. And it's enforced by local authorities. Many of you on the call will know that and be very familiar. But what we wanted to do is really better understand what the context in which these new, very novel, world-leading regulations were being implemented into. So what we did is we used rapid qualitative methods. These methods became very prominent during COVID and the vaccine rollout, where it's live and you're doing very rapid qualitative assessment and feeding information back to policymakers and to implementers. And what we did is we took a systems approach, and we heard from a whole range of different stakeholders across the system. And then we validated the results and did a prioritization of our recommendations through an online conference that was very well attended, because there was a lot of uncertainty and lack of clarity around the details of this regulation. So what did we find? Well, by exploring the context in which they were being implemented, we found that actually many people said that this was a really good first step, and recognized that obesity was a complex issue, and that this food policy didn't rebalance the cost concern between healthier foods being more expensive than unhealthy foods. But 2 key elements came out, and one was around real concerns that the exemptions, the store exemptions, and some of the exemptions around the products may actually exacerbate inequalities. And there was also real concern about exploitation of loopholes, and that actually that could undermine health in the broader context, such, for example, alcohol is not included in this regulation, so has been quite prominently placed at the end of aisles. We also found that there was fears around that inconsistency of approaches may actually affect its impact. And 2 key areas there were really around the complexity of these regulations, and that they weren't necessarily communicated in a way that was effective, nor the tools were available, such as which products are in scope HFSS and which are not. And also there were real concerns about resource limitations, particularly for local authorities in enforcing this legislation, but also for smaller stores who don't have the capacity to be able to implement, and the resources to be able to implement the same way that the very large supermarkets and chain stores are able to. So what did we see when this legislation came in? Well, we actually, on the left-hand side, the 1st of October 2022, we saw a really big change to supermarket environments. We saw non-food items on the end of aisle. We saw vegetables and water at the front of the store. But by the time a couple of months later we got to Christmas, we saw this huge exploitation of loopholes. So where there were bin drop displays, you can see here all the confectionery from Christmas is actually creating a new aisle. So the first aisle had been widened and these bin drop displays were being used. So a huge amount of exposure, but all compliant. But we also saw components of non-compliance as well. And really what this came down to is insufficient enforcement of food policies. And this really is the 4th reason why our food policies haven't achieved the impact that they could be achieving, or why they're failing the population to achieve a healthy diet. And really there was a lack of government leadership and resourcing around this. But for this particular regulation, it also came out that actually this is a whole new framework. So you're asking environmental health and trading standards to kind of adopt a new framework to enforcement that we haven't had to do. And it won't be prioritized because of there's other more urgent concerns and policies that need to be implemented. And of course, we have seen that there's been insufficient funding for enforcement of this regulation. And also that we can see that then that has had a huge impact on actual compliance. And you can see lots of cases of non-compliance here. And I'm just going to wind up by saying, therefore, insufficient enforcement of food policies is one of the key reasons why our food policies have failed. And you can see that this is in other food policies as well, so school food standards and also calorie labelling. And then finally, I just wanted to end on this slide to say, actually, there's lots of things that we can do to optimise food policy effectiveness and equity going forward, using joined up approaches to food policy, prioritising structural policies, using systems-based context to really assess pre-implementation so we can better finesse the implementation of food policies, and also to build adequate resourcing for enforcement. So thank you very much for listening.
Many thanks, Christina, for your presentation. That was really excellent. And I think what was particularly stark was that lack of joined up working in terms of food policy making, and that major challenge in promoting food security and creating that robust food system. And also noted the points about the importance of leadership at regional level and how we address some of those structural factors in creating improved food policies. Thank you. Could we possibly take a couple of questions before we move on, if that's okay? I think I've been fed through some questions from the audience. First one is perhaps, how can we build a case for upstream system and policy action to influence others who have a belief that healthy weights more around personal responsibility?
Yeah, so I think the ongoing question, isn't it? And actually, I think some of those approaches to challenging people's values, challenging people's perceptions around that, and providing evidence of lived experience is really important. So those stories and narratives are really important, combined with statistics, and using and challenging people and using language in a way that really can highlight actually the structural barriers that many families face. Although there's a willingness and a desire, there's just not the resources or the capacity to be able to implement sort of the desired food behaviours or food practices. And I think that we in public health have a real role to play there in terms of gently challenging this perception of individual responsibility. I think that we all can do that, particularly when we talk to industry or commercial or business barriers. I think we definitely want to be talking more about those narratives and challenging that perception that it is just up to individuals.
Thank you, Christina. And just one final question before we move on. In terms of what you've presented, what would be the biggest lesson you would pass on to the new government to help finally turn the tide on rising levels of obesity?
Yeah, I mean, I think the four points need to be taken on board. So one is we do need a long-term joined up strategy that addresses the structural determinants of poor diet and that structural commercial determinants of poor diet. And really that we also need to ensure that there is adequate understanding of the context within which they're being implemented, so that those who are experiencing poor diet to the greatest extent are not those that don't benefit from these policies, which is what we have seen. And so to do that, we need adequate resourcing and tools for enforcement, and then regular review to close loopholes, because sometimes you do need a framework policy that is got on the table, but then we do need to review that policy regularly to ensure that that things are lined up. I think the House of Lords report, the Recipe for Change, gives a really good narrative of how we could start to do that, but we need to start to also thinking about the long-term perspective where we're increasing opportunities for consumption of minimally processed foods in order to then slowly diminish our intake of processed and ultra-processed foods.
Thank you. Thanks very much, Christina, and thanks again for a wonderful presentation and setting the context and opening today's conference. Thank you for joining us.
Thank you.
Thanks. So I'd now like to introduce our second speaker this morning and chair of our panel debate, Dr. Hannah Brinston, Head of Policy and Advocacy at the Food Foundation, to take us through the emerging opportunities with the new incoming government and what we know so far. So thank you, Hannah.
Thank you very much, and thank you very much for the invitation to join today. So I'm going to, as Nicola said, be chairing a session in a minute, and I don't want to take any of the kind of the panelists' limelight. So I'm just going to give quite a quick overview of where we've got to with the current government, what we know, where we've had progress and where we haven't. I'm going to try and stay optimistic although we know that maybe progress hasn't been quite as fast as we want. And I think, firstly, just to reflect on the new government. Obviously, I'm assuming everybody on this session remembers we do actually have a new government. It feels like an awful long time ago since we had that election. But it's actually been quite a stop-start few months. I think it's about 4 months now that we've had the new government. But because of conference season, summer recess, etc., it's not been what you would consider a kind of typical 100 days plus time. So it feels quite hard to see what has changed. But I do think, starting with the sort of the media narrative that we've been seeing, I do think that sort of food and health has actually been quite prominent in the media over the last few months. And I think there's been quite a lot of appetite to be discussing these issues. Not always necessarily the framing that we would want to be seeing. I know there's still some sort of persevering sort of media headlines around kind of nanny state concerns and things like that. But I think overall, what we're actually seeing is quite a strong emphasis on the need for improving health, improving diets, prevention. There's been increasing kind of coverage and concern around child poverty, for instance. And I think all of this is a really positive step in the right direction for trying to kind of push the new government to actually take some action. So I think we can be quite positive in that sense. I think one of the tricky things that we're also faced with the government and some of the things that they're trying to kind of battle with at the moment is, while on the one hand the Labour Party got quite a landslide victory at the election, they've got a lot of seats. I don't think there's any sort of expectation that that's a certainty going into another government term. So the government is trying to kind of battle with this long-term thinking, to Christina's point, trying to, what can they do over 5 or 10 years, but also trying to make sure that they keep the voters kind of on side. And that's quite a difficult line that they're having to walk at the moment. So it's very interesting kind of politically at the moment to see how things might evolve over time. If I can go to the next slide. We have seen quite a few things, even though I've said 100-ish days, we're around 100-ish days plus a budget. We have seen some progress, largely things that we were expecting based on what Labour kind of committed to in their manifesto. So we have seen, the commitments to bringing in the junk food advertising, banning energy drink sales to under 16s, the review of the National Planning Framework, which kind of shifts the sort of emphasis, I guess, onto proving that something won't impact health rather than that it will, which just sort of shifts the narrative, making sure that sort of health is more intrinsically there in planning. We've got the commitment to primary school breakfasts, which is sort of an acknowledgement that nutrition at school is really important. We've had the announcements related to the Child Poverty Task Force, which shows that sort of that interest and commitment to addressing child poverty, recognising that it's a bit of a scandal, really, the number of households that are currently impacted by poverty, impacted by things like food insecurity. In the budget, we had an announcement that the soft drinks industry levy, sorry for the acronym on the slide there, the soft drinks industry levy is going to have some overdue sort of enhancements, shall I say, so increasing the rate that manufacturers have to pay in line with inflation, and also consulting on the actual sugar thresholds that are included in the levy, and extension to prepackaged milk-based drinks. So this, although it is very small, it's definitely not far enough. Myself and others from Sustain OHA are sort of working on trying to get more towards a food levy. Actually, seeing some improvements, recognition in this first budget is a really important step and indication that there might be scope for progress in this area with the current government. And we've also seen in the wider sort of affordability poverty space, we did see some announcements related to wages in the budget. So there has been some positive things that we need to kind of grasp, and how we can kind of build on that momentum to highlight what else needs to be done. And I hope that the government is going to give Christina a chance to go in and talk to them about how they need to address everything together, and that having just kind of this piecemeal approach isn't necessarily going to address the issues that they want to. I've put in brackets on the slide just a couple of other things that have happened sort of in parallel. They're not sort of directly related to kind of government policy per se, but we have obviously had the House of Lords report, and I think that sort of actually did a really good job of covering quite a wide range of policies that we need in this area. And I think with that, and then the National Food Strategy that was published a few years ago, I think we have some really good kind of roadmaps, blueprints, whatever you want to call them. So I think there's a role for those of us working in the kind of policy and advocacy space to really demonstrate how these things fit together, and how we can kind of build on what's already been done. You know, a lot of the thinking, a lot of the work has been done. This is not, this is not a new space. Actually, what we need now is that action. So I think we all need to kind of be thinking about what opportunities there are to kind of elevate those recommendations. We also had the 9 metro mayors announce a commitment to banning some outdoor advertising, which is great. And the mayors are a really interesting group at the moment, because we have most of them are Labour mayors at the same time as having a Labour government. So I think there are some opportunities that we should be looking at there. We're doing some work kind of in the poverty space and around free school meals, but there will be other areas where we can kind of use that group of mayors sort of effectively on the public health, nutrition and food agendas. And I think going back to just after the election, in that first week when the sort of new government was quite efficient in getting into all of the departments, etc. One of the things that did happen was Keir Starmer had all of the mayors down to number 10. So I think there is a lot of potential there that we should be looking at that more regional and local level, as well as just focusing on the kind of the role of national government in that national space. And then specifically on early years, just to flag, we had a CMA report on formula, which I'm sure Vicky will mention in a minute. But again, this sort of had some recommendations around the formula market at the moment. A lot of formula is extremely expensive at the moment, which is really problematic. And again, having this report coming out now, I think is really good timing with a new government. So there were a lot of things that potentially were sort of delayed. So like the House of Lords report, for instance, we were anticipating would come out under the old government. Actually, the fact that they were able to get that extension and able to publish with the new government, I think is a massive opportunity and was really good. So I think there is a lot going on. That said, there is still a lot of things that we've not really seen much from the government. And I think we're going to, we need to sort of make sure that they recognise the opportunities and the need for intervention in other places. So while we've seen the Child Poverty Task Force announced, for instance, we're yet to necessarily see any concrete steps to reduce poverty, reduce food insecurity. So I know that they're discussing this, but we really need to be taking those discussions into action and seeing some meaningful steps taking place. We've seen a lot on breakfast specifically for school food, but it's really important that the government also looks at improving school food standards and also looking at school food throughout the school day. So that also includes free school meals. So I think this is a gap at the moment and something that we'll be looking to the government to sort of take action on as soon as we can get them to. Healthy Start as well is it's a relatively low cost policy, but is really important for those who are entitled to it. And again, I think this was a Labour policy, so I think there is huge opportunities to try and get them to actually make some meaningful improvements to Healthy Start, whether it's by increasing the eligibility, the value, making sure that everybody who should be getting it does actually get it. I think all of these things are really important areas that the government could and should be taking a lead on. I've mentioned horticulture here because obviously it's linked to fruit and vegetable consumption, which is where we know there are some of the biggest inequalities. And again, looking kind of towards DEFRA to take a bit more decisive action in this this area to really kind of improve what's being done at that part of the food system. Then FDTP, so this is around data transparency. Under the old government, there was a commitment to have originally mandatory reporting, then it went to voluntary reporting. We're sort of still in the process of waiting to see what happens next with that. But I think, again, it's a really important opportunity to try and get sort of mandatory reporting in place that can then underpin and inform a lot of future policies to make sure that we're thinking, around what is happening, making sure that we're addressing any loopholes, etc., just by better understanding what's being sold. And then generally, the early years continues to be a kind of underrepresented area in policy. We're expecting some voluntary kind of commercial food guidelines out, which haven't come out yet, but I think there's opportunities for the government to be doing a lot more in this area. And I know there's a huge number of people working in this space. I'm hoping that will build some momentum over the coming months, hopefully not years, but at least months. Just to flag, at the Food Foundation, we've been doing a lot of analysis of the sort of whole election period, from the manifestos that came out through to first 100 days, budgets, etc. So if you go onto our website, you can kind of find our analysis across the food and nutrition space if you want more information, and I can pop some links into the chat. So I'll stop there. I've started talking about some of the themes that I think are going to come up in the panel discussion in a second. So we've got 4 experts in 4 different policy areas who are each going to kind of pitch why the government needs to be taking more action in the area that they work on. We're going to have, I think, probably time for maybe 1 question per panelist after their pitch. And then once we've done all 4, we'll then have a couple of general questions. So please do be posting things if you have any questions that come up as people speak. So our 4 panelists today, we've got Dr. Vicky Simpson, who is Director of First Steps Nutrition Trust, Stephanie Slater, who is Chief Executive of School Food Matters, Laura Burgess, who's Head of Policy and Research at Resolve Poverty, and Adam Briggs, who is Senior Policy Fellow at the Health Foundation. So we're going to start with Dr. Vicky Simpson from First Steps Nutrition, who's going to kick us off and talking about the early years. So over to you, Vicky. I will put my hand up at 4 minutes so you know where you are in your timing.
Great, thank you, Hannah, and thanks everyone who's listening in. Thanks for the invitation to speak. So the problem I want to speak to, building on that introduction from Hannah and Christina, is that average diets in the early years, and I'm talking preconception to age 5, fall a long way short of public health recommendations, including low prevalence of exclusive breastfeeding and early cessation of breastfeeding, early introduction of solids, that's before 6 months, widespread consumption of unnecessary toddler milks, and in the 1 to 5-year-olds, high intakes of sugar, salt, saturated fat and protein, and too little fibre, as well as low intakes of iron, zinc, vitamin A and vitamin D, likely among certain groups of children. And also there are huge dietary inequalities. So, for example, national surveys show that women in households with low socioeconomic status are less likely to breastfeed than their affluent peers. And data from the Food Foundation show that purchase of fruits, vegetables, fish are lower in food insecure households. And as Christina said at the beginning, highlighted, households with under 4s are more likely to be food insecure than households with no children or with older children. And all of this is an issue because poor early years diets are a driver of ill health in the short term and the long term. We saw last week that levels of overweight and obesity in reception age children in England are on the up compared to last year at 21.3%. So with more than 1 in 4 children overweight or obese, that's a massive problem. And at the same time, 1.2% are underweight. And we also know that dental caries is an issue too. So in terms of why this problem is relevant to our government's missions and priorities, healthy early years diets are key to creating the healthiest generation of children ever. and to achieve this pivot towards prevention. And this is because growth trajectories are set in infancy and early childhood. So that means a child that's gained excess weight by age 1 or 2 or 3 years of age is very likely to go on to continue having an unhealthy weight at school and in adolescence. So basically overweight and obesity tracks over time. You have to get in there early. It's also because food preferences and habits are developed in the first years. So if during infancy and as a toddler, a child isn't given vegetables, we can't expect them to, when they appear at the school lunch, for them to accept them. If they're given a steady stream of packaged snacks as a baby and a toddler, we can't really easily expect them to go on to eat a healthy meal, a pattern of healthy eating that comprises of 3 meals a day. So my one policy ask, my call to action amongst many, would be that the government starts by publishing the voluntary baby food guidelines, which Hannah mentioned. So with political will, this is achievable, and it's pushing on what should be an open door. The guidelines have been ready since early summer. So OHID did a closed consultation with key stakeholders in the spring. They're there. We understand they're ready to go. The issues with the commercial baby food offer were clearly outlined by Public Health England in 2019. That's 5 years ago. So we're increasingly anxious that this is it's been exposed quite some time ago, and it really needs to be dealt with. Ireland published guidelines in July, so that shows the UK are behind the curve. And I just want to say the guidelines we have are not ideal. They're voluntary, so I just want to highlight we'd want them to be mandatory. They fall short of WHO Europe's recommendations. And for example, toddler milks aren't really covered anywhere, so they could conceivably be covered by the baby food guidelines. But implementing these guidelines would be a start, and OHID could evaluate industry compliance after a year or 18 months and take appropriate actions to address poor compliance. So for example, moving on to make them mandatory. So that's one key ask, pushing on an open door, which we think would make a big dent. And there's more asks at that link there in a 2-page brief that we led on producing with the OHA. Thank you.
Thank you very much, Vicky, and thank you for sticking to time very well. So just a couple of questions. I'm thinking maybe you don't know, but do you have any idea when the baby food guidelines are likely to be out and why they haven't been published yet?
No, we don't know. And it's very hard to understand what the blockage might be, other than industry interference. Frankly, it's very, very hard to understand what's objectionable about taking action on this, given the problem's been so well described, and given that we're talking about babies and young children. It should be a no-brainer. Yeah.
Okay, so that's something for us all to be kind of taking forward. One other question, are you aware if the government is planning anything related to increasing rates of breastfeeding? Is there anything in the pipeline that you're aware of?
That's obviously quite a broad question. It's a really good one, because enabling breastfeeding should be a priority. It's we know that most women in the UK want to breastfeed, and that a lot of 8 out of 10 women who start don't meet their breastfeeding goals. So there is need. We know that there is sort of a postcode lottery of access to the support that women need, and Food Foundation's report on this highlighted issues with low statutory maternity pay, so economic barriers to continuing breastfeeding. Plus we've got the marketing side, and the fact that the way formula milks, bottles, teats, baby foods for use under 6 months, all these products are marketed, undermines breastfeeding and safe and appropriate formula feeding, and that's why the CMA report is quite exciting as an opportunity to look at strengthening that. So what I haven't done is answer your question there. I've acknowledged that there is a need to do a lot in this space. I don't think the government I don't think they're looking at it the way we would like them to be looking at it, and it's a matter of seizing on these opportunities and bringing them together. So there's a commitment, I think, there's been a short-term commitment, I think, to ensure ongoing funding for the family hubs in the 75 most deprived areas, but it's only short term. So there's some commitment, but not enough. And we would like the government to be seeing infant feeding in the round and looking at that whole package of interventions that are needed to enable breastfeeding.
Thank you, Vicky. And I think that theme of looking at things in a round, seizing on different opportunities is certainly going to be a theme, I think, across a lot of different policy areas. So something for everyone to kind of take home and think about. So thank you very much, Vicky. We'll move now on to Stephanie Slater, who is CEO of School Food Matters. Stephanie.
Hi, everybody. I'm not sure you can see my video, but I'll just keep talking. I'm just looking at my name at the moment. Anyway, here we go. Start my video. Yes, I am here to dig into school food. So over the past 17 years, School Food Matters has been on a mission to ensure that every child has access to delicious, nutritious and sustainable school food. You'll hear me say that a lot today. In 2007, the campaign began with a focus on quality, but our work has since had to pivot in response to the two challenges of hunger and health inequalities. Great steps were taken in 2013 with the school food plan, but we must do so much more to ensure equity across the school food system. And to do that, we need to address looking at policy in the round. We need to look at access, funding, and quality of school food, all three, not one. So just to start with access, all children and young people should have access to good nutrition they need to thrive. But Child Poverty Action Group shows us that over 900,000 children who are living in poverty are unable to access a free school meal owing to the draconian eligibility threshold. I'm sure everyone on this call knows what that is, so I won't go into it here. It's not fair that schools across the country are having to take drastic measures to support their communities. Many are introducing food banks in the school grounds and using their own budgets to feed hungry children because they're not eligible for a free school meal. At the very least, the Labour government must take steps to ensure that every child currently eligible for a free school meal gets one, because we know that too many families are missing out because of the administrative burden of applying. So auto-enrolment. Many local authorities are showing great leadership here and showing that it can be done, saving families money and attracting pupil premium to the school budget, which is so needed. Funding. At present, school food funding is inadequate. We recently launched a report that revealed the real cost of a school meal. This piece of work brought together experts from across the school food sector for the first time since the school food plan to highlight that just investing 63p more per meal could have huge benefits for children's health and learning and provide stability across the sector. Without an uplift to reflect inflation, the system is stuck with little opportunity for innovation and a danger of cutting quality to cut costs. So on to quality. We talked about standards already, haven't we? So the school food standards were introduced in 2014 and enshrined in law, but without effective monitoring, compliance is patchy. So we most recently, the Food Standards Agency ran a successful pilot aimed at monitoring implementation of standards. We know the House of Lords Food, Diet and Obesity Committee recognised that too many schools are failing to comply and calls for government to immediately review and update the standards, and underscores the importance of ensuring that the standards apply to breakfast, as the free breakfast clubs are about to be rolled out to all primaries. So the standards are long overdue for an overhaul to reflect dietary guidance, and it was actually promised in the 2016 Child Obesity Plan, so it's long overdue. The work began and was bold, but was scuppered by COVID. But with the advent of the breakfast rollout, it's become more important than ever. So our vision, obviously, is for every child to have the same opportunity to enjoy delicious, nutritious school food. So no matter where they live, because obviously we have a postcode lottery at the moment with different schemes running across the country. A great school food culture means children leave school in better health. They're less at risk of food-related ill health and are able to play a full and productive part in society. So addressing these problems in relation to the government's missions. Well, investing in school meals offers a clear route to breaking down barriers to opportunity for children. Labour has said they want, as we've heard, the healthiest generation ever, and school food is an integral part of delivering better outcomes for children across the country. So it's good for children, it's good for society, and it's good for the economy. The Labour government is already taking radical steps in the school sector, so reforming Ofsted, reviewing the curriculum, introducing breakfast. It makes sense to consider school food as having a part to play in helping children to reach their potential. Investment in school meals is good for children. It's good for families. It's good for growth. I'll keep saying it. And schools and local authorities are facing so many pressures. We need to secure a better future by investing in school meals, because it's investing in public services. So I was asked to think of one ask. Obviously, I'm going to be cheeky and say we must consider school food in the round, access, quality and funding. But if I'm going to be pressed to say one thing that government needs to do right now, it's auto-enrolment. So we can make sure that children who are eligible are receiving a school meal. But I just say, be ambitious. We need to look at the quality of school food, and that requires monitoring. There was a chapter in the school food plan called What Gets Measured Gets Done. We're still not measuring, we're not monitoring, and in that way, we can't guarantee that investment in children's food equals good nutrition. I'll stop there.
Thanks very much. And I like you ending on let's be ambitious, because I think that is a very good thing that we need to be all sort of embedding in our work on school food. So a couple of questions have come in. I'm going to kind of combine two of them, I think. So one is, do you have any sense of where the kind of school food standards review is at, whether that's likely to come up, and whether the breakfast offers an opportunity for us to actually get that back on the agenda, or I don't know.
I really hope so, Hannah. I mean, I think I mentioned that we started the work on the school food standards, but pre-COVID, and so we were beginning the testing phase when lockdown happened. The revised school food standards were really ambitious, and we were very hopeful. But then there was a switch within the department. I think lots of people would have experienced that, where they moved, and it quite rightly acknowledged the fact that without compliance, even if we have standards enshrined in law, it doesn't mean that standards are going to be complied with. So I kind of agree that until we get the compliance piece worked out, it's kind of fruitless, but they have to happen in tandem. I truly believe that breakfast gives a great opportunity for this, because, we have to keep reminding the sector that school food standards apply across the whole school day. That's breakfast, after school. And I think that we need to keep reminding government of that. Logically, we would say update the standards, mandate, and launch a massive comms plan to line up with breakfast. But I think, baby steps. We've just got to keep having the conversation and reminding folk that they do apply across the whole school day, and they are mandated. But Food Standards Agency, that could be really interesting. Let's see where that goes.
Very quickly, actually, on the school food, on the FSA, do you know if there's any plans to pick up the pilot and take that? Is there interest or appetite to do that?
I know that Food Standards Agency are very committed to it and enthusiastic about it. Obviously, Susan Jebb was one of the author of the standards way back in 2012, 2013. So there is enthusiasm. Whether or not they have the ear of DFE right now, I think DFE's eyes are absolutely focused on breakfast at the moment. So we just have to keep plugging away.
Thank you very much, Stephanie. And I think we're going to hear a little bit more about auto-enrolment in the second session of today's conference, so we can revisit some of these issues. So thank you very much, Stephanie. We'll now move on to Laura Burgess, who is Head of Policy and Research from Resolve Poverty, who will be delivering the next pitch for action for the new government.
Thanks, Hannah. Hi, everybody. So I'm Laura Burgess. I'm Head of Research and Policy, should I say, at Resolve Poverty. So we're a not-for-profit organisation working locally to end poverty nationally. We support localities with their efforts to resolve poverty as part of a national mission to end it. Thanks very much for asking me to speak today at this conference. So I'm sort of here to talk about how poverty impacts people's ability to access healthy, nutritious and appropriate food. And just a bit of background. So we know that poverty is a blight on people's lives. It holds individuals back from realising their potential. It harms the country economically and socially. We know that around 1 in 5 people in the UK live in poverty today, and children have the most persistently high poverty rates compared to other age groups. So despite poverty being an entrenched issue in this country, successive governments have done very little to address it over the sort of last decade and a half, possibly a little bit longer. There's a lot of government policy relating to poverty that I could speak about, but I'm just going to focus on one thing today, and that's local welfare assistance schemes. So local welfare assistance schemes are budgets that are held by local authorities that can be used to support people experiencing financial crisis. They're pivotal in providing a safety net for people who fall through the cracks of the social security system, or for people who aren't necessarily in the social security system but have a big sort of financial shock that does happen in people's lives. They're particularly important at the moment because the current social security system doesn't necessarily cover all of the essential living costs, so they're sort of more important than ever at the minute. So unfortunately, as you can see from the screen, from the slide, not all councils currently operate a local welfare assistance scheme. And so that means that coverage to the population is patchy. This is down to sort of council funding and the sort of wiggle room that they have within council budgets. So over the last few years, and probably colleagues who are on the call today, they've probably heard of this, but since the COVID pandemic, the government have offered short-term pots of funding. It's currently known as the Household Support Fund. This is provided to councils to help support residents experiencing financial crisis. So it sort of started during the COVID pandemic and continued because of the subsequent cost of living crisis. So most councils use some or a majority of this funding to support food banks, provide food parcels, energy vouchers, other types of what we call in-kind support to residents experiencing financial crisis. And I suppose it's our view that whilst there does need to be some provision for emergency food aid, the UK social security system has become too reliant on food aid as a sticking plaster instead of addressing the root causes of poverty and hardship. So food parcels, food aid in general mean that people who are struggling with finances are limited to getting their food from either a food bank, which might not have on offer a full range of healthy, nutritious food. They might just be sort of offering surplus food that's come from supermarkets and other areas. The food might not suit all dietary requirements. We know that people who have very specific dietary requirements might not be able to access the food they need in food banks, and it might not also be culturally appropriate. And if they have to go and use a voucher from a specific supermarket, again, it might not suit all their needs. So instead of offering food parcels and vouchers, we believe that local authorities should offer a cash-first approach to welfare support, meaning that people who are in financial crisis are provided with cash rather than other types of in-kind support. And obviously the bulk of social security in this country is given in cash in the form of benefits. When we say cash, we sort of mean money into people's banks, not just a sort of envelope of cash. So it's sort of peculiar that local welfare support doesn't follow the same, and it sort of sits separately in a sort of food aid space. Some councils in the country do offer cash support, so we know that this is happening. It's quite small scale. It's becoming increasingly prevalent, but rates are still low. And our belief is that cash gives the user who is experiencing poverty, experiencing financial crisis, it gives them choice, dignity, control in what they spend it on, and it isn't restricted or limited in any way. So I suppose our ask of the government in this space is to provide long-term ring-fenced funding to ensure every council in the country can operate a fully functional local welfare scheme. So the problem with Household Support Fund and its prior iterations is it's been done in sort of 6-month sections, and it doesn't give the councils chance to provide sort of a long-term plan for this bit of funding. And we would hope that there would be a requirement in that sort of ring fence long-term funding for a proportion of it to be allocated to cash support for individuals experiencing financial crisis. And in terms of how this sort of meets with the government's mission. So we think this step and the wider reform of social security system is crucial to the government's mission of breaking down barriers. You know, we know that poverty impacts people's lives, and you know, we know that people are in poverty in this country because of a lack of money, not a lack of food, or not because of a lack of healthy food. Thank you, Hannah.
Thanks very much, Laura. Some really important points raised there. I wanted to ask a question actually around kind of holiday hunger and the HAF program, and whether you had sort of any insights as to kind of what's going to happen when that runs out, or if you have any sort of thoughts on how we should be better preventing kind of holiday hunger for those families.
Yeah, so a lot of the HAF funding does come from household support fund as well. So some of that is segmented off into those budgets. We're a bit unsure about what will happen at the end of the next tranche of household support fund. It was just announced that it will run for another 6 months, but beyond that, we're not sure. We're part of a big campaign group of other sort of like-minded organisations, probably many on this call today, that are calling for that sort of long-term funding. And you know, we do recognise that children who are eligible for free school meals should be covered, and they should be able to access nutritious food in the school holidays as well. We would just hope that that would again be able to be provided in cash to those families, because we know that cash can go a lot further than a food parcel, and it just would maximise that dignity and choice for the family there as well. So unfortunately, I don't have the answer as to what's going to happen. That's all still a bit up in the air, but we are part of a bigger call to advocate for that.
Thank you. And then one final question. Obviously, we know that there's the child poverty kind of action plan or strategy that we'll be expecting to see next year. I know you've kind of talked about what you want kind of from government generally, but do you have a specific ask of what you'd like to see in that action plan to kind of address food insecurity, particularly in young children?
Yeah, so we're really pleased that the government have committed to a national child poverty strategy. It's something that we've been calling on for years. You know, what we always say is that the main levers for tackling poverty lie with central government, but there is a lot that localities can do in that space, and we're really pleased that the government is engaging with ourselves, with many of our sort of partner organisations on this strategy. We'd like them to ensure that the voices of localities are heard in that strategy, so that they know what's happening sort of on the ground in local authorities at the moment, so they can learn from best practice and be able to sort of replicate that wider across the country. And I suppose a crucial element to that would be long-term sort of funding for local welfare support. As part of a wider reform of the social security system, I suppose I can't sort of finish this brief talk without referring to the two-child benefit limit, which means that it plunges thousands of children in poverty, and if the government were to scrap that, then that would almost overnight lift a lot of children out of poverty. So we think that is crucial. The government haven't made any indication that they are intending to do that anytime soon, but that would be a key ask as part of that as well.
Thank you very much,
Thank you,
Laura. So finally, we're going to hand to Adam Briggs, who is Senior Policy Fellow at the Health Foundation, to give us our final pitch for what we want to see from the government. Thanks very much, Adam.
Thanks, Hannah, and lovely to see you all here this morning. So I'm going to give a bit of an overview of where I think we are from a policy perspective, looking across obesity and prevention policy more broadly. And some of it will overlap with Christina Vogel's talk earlier this morning, but hopefully reinforcing some of those points is no bad thing. I mean, from a problem lens, obviously we have an ongoing challenge with obesity, and we've heard clearly about its role in driving poor health and inequalities across the country. And this starts in childhood with over a twofold difference between rates of obesity among reception children and similarly and even wider differences among year 6 children between the most and least deprived parts of the country. The challenge for the government is not only its relationship between obesity and poor health, but also how it then relates to other ambitions that the government is trying to push forward within its mission programme, and particularly around economic growth and being overweight and obese being a key driver of working age poor health and challenges around productivity and workplace engagement. So when we talk about obesity and other preventable areas of poor health from a public health perspective at the Health Foundation. We think of this in the broader terms around what that means for an individual, what that means for a family, and also what that means for society, and understanding those broader societal implications, but also the opportunity that it presents to get on top of some of these preventable conditions means that some of the political rhetoric around how we communicate about the challenges can be strengthened. And we've heard that a little bit in what Labour has said so far. So we heard earlier about the King's speech, and Hannah, you presented yourself as well around the commitment to the restriction of junk food advertised to children, along with restrictions of sale of high caffeine drinks to under 16s. And I take that as a positive signal, but that's only going to be the tip of the iceberg in terms of what's needed over the coming years to provide a step change in obesity. Furthermore, these policies that were first announced were both legacies for the previous government. So in terms of what actually Labour itself is saying it's going to do, one of the things we've been pushing about is a bold use of tax and regulation. The rhetoric around obesity as a challenge for individuals versus societal challenge is a false dichotomy, in my opinion. The broader determinants of what makes us healthy, those structural factors, are where the biggest gains are going to be made in terms of population health, as well as in tackling inequalities. And that's when issues around things like revising the soft drink industry levy thresholds, which have been mentioned, may have a role to play. But much bigger wins can be had around extending that approach to unhealthy foods. Similarly, I think the consultation on national planning policy framework, particularly around the closer integration of health and planning decisions. So not just around restricting the opening of hot food takeaways near schools, but thinking more coherently about health can be considered as we develop and meet the hugely ambitious housing targets that Labour have put in place, is going to be really critical and could potentially be a huge long-term win if we were to be able to get that right. And thirdly, around unhealthy food advertising, we've seen obviously in areas where devolved responsibility exists in London, in restriction of unhealthy food advertising on the transport network, the benefits that can have for population health. And one of the areas we're calling for is the ability for that type of restriction to be extended to the rest of the country, whether that's administered by local government or elsewhere, to be able to restrict unhealthy food advertising on non-council owned spaces. And then when we think more broadly about what drives health, we know, for example, that people living in the most deprived part of this deprived quintile are over four times more likely to have limited access to green space, but 5 times the density of fast food outlets. And these types of structural challenges is where opportunities around planning, around creating healthy places, and around thinking more coherently about what drives health and well-being can have the biggest wins. And that's where I think some of the opportunities for the Health Mission land. One of the areas we've spoken about a lot at the Health Foundation is what we call health at the heart of government. And whilst it's a little bit wonky, if you can get the processes right to understand how different government departments can all pull in the same direction when we talk about prevention and when we talk about tackling inequalities, you get some of the biggest gains. And to do that requires the kind of infrastructure that has some independent oversight of those health ambitions, as well as critique. And some of the models we put forward are around things like replicating the UK Committee on Climate Change and putting in statute some of the ambitions around creating good health, increasing health life expectancy and narrowing inequalities, provides the kind of structural framing from a legislative perspective that can support all government departments from taking the kind of action that is needed. The one final thing I want to say, and I know we might talk about the budget in a bit, is that in the budget, one thing we heard about was a bit of increased funding to local government, but we didn't hear about changes to the public health grant, which has seen a 28% reduction in funding per capita over the past decade or so across local authorities. And if we're serious about doing this, then ensuring that local authorities and public health teams have the resource and capabilities they need to be able to meet the local needs of populations. And that's not just public health teams and their commissioning of healthy weight services, but also those wider teams in trading standards, planning, licensing, environmental health, etc., that are going to be so critical to delivering some of those broader societal shifts required to improve population health. So my final bit to say, thanks Hannah, is that we know that UK life expectancy gains are stalled. We know that the burden of preventable health continues to rise and inequalities continue to widen, and that taking a mission-led approach, I think, presents a real opportunity not just to take on obesity and unhealthy food, but hopefully to reverse some of these trends more broadly. Thanks.
Thanks very much, Adam. And you started talking about the budget there, which I think we're going to come on to in a minute. We bring all the panelists back, but just one very quick question I wanted to ask you in the kind of context of health and not necessarily the prevention that we've been talking about today, but prevention. The government's talked about weight loss drugs, and I just wondered what your take was on whether that's a kind of help or a hindrance to sort of better investment in public health and prevention generally.
So, I mean, the first point is that weight loss drugs clearly work, and they clearly work for a lot of people so far, mainly in developed parts of the world. My nervousness about the rhetoric around weight loss drugs is that it's seen as a magic bullet, and everything we've heard today and everything we know from the evidence is that if we are going to get on top of unhealthy weight and support people to have healthy and more productive lives, that a single solution isn't going to be sufficient. For a very practical purpose, we couldn't afford it. We would be completely compromising the rest of the NHS budget if we were to be giving weight loss drugs to everyone who are overweight or obese. But more broadly speaking, the kind of issues that drive unhealthy weight and the inequalities surrounding unhealthy weight, as from a societal perspective, not only have consequences for obesity, but also for a whole range of other preventable long-term poor health conditions. And so there is a real opportunity, I think, with weight loss drugs to have something additional in our clinical provision to support people who really do need support, but that needs to be provided in a way that's clinically grounded, evidence-based, and has the surrounding support for people who will need it to change diets, etc., for when they come off these drugs. But if you are putting people back into the environment from which they came, and you're not looking to change the underlying structural circumstances that have driven unhealthy weight in the first place, then very little is going to change over the long term.
Thank you very much for that, Adam. So I think we're going to bring the other panelists back in now. So Adam started to talk about it, but I wondered if the other panelists, and Adam, you can jump back in if you want, had any reflections specifically on the budget that we had, I think, was it last week now, 2 weeks ago? Just in relation to the issues, kind of what was good, maybe one good thing, and maybe one thing that you would have liked to see, or you'd like to see in the sort of spring budget 3-year spending review coming up next year. So we will go to, actually, let's stick to the same order. I don't know, Vicky, do you want to come in first?
Yeah, happy to. And again, repeating a little bit what others have already said, the budget from an early years nutrition perspective was really underwhelming. And the obvious omissions were nothing said about Healthy Start, which is meant to be our nutrition safety net. And with the massive high levels of food insecurity and what we know about the consequences of inadequate diets in the early years, it just doesn't match up with the government's rhetoric around child health and prevention. And the other big one Adam just mentioned was failure to acknowledge the insufficiencies of the public health grant. And I can't think of anything positive to say. Isn't that awful from an early years nutrition perspective? So there you go.
Stephanie, do you have anything positive you want to add?
Oh, look, you know me, Hannah. I always find something positive. Positive, obviously, is a big investment in breakfast, 30 million. So that's exciting. Our job is to make sure that is quality breakfast and it meets nutrition needs, and it's not just framed around hunger and just giving children something. It needs to be good for their health and well-being. Obviously, we know what's missing. We know that, that we still have a very draconian threshold. 900,000 children living in poverty are not getting a free school meal. I mean, that's completely bonkers. And it's not for schools to plug that gap. Schools are strapped, so they shouldn't be dealing with nutrition issues. And, we obviously know that the one thing that does need to happen urgently and could be cost neutral for government is auto-enrollment, so that those children entitled get a free school meal. So that's what we're going to be looking for.
Thank you very much, Stephanie. And Laura, do you have anything to add to that?
Yeah, I mean, I'd agree with Stephanie there. There was good news around the breakfast clubs. I mentioned it when I was speaking earlier. There's good news around the extension to household support fund that isn't just sort of dropping off and ending as we thought it might do. but it needs to go further. I think colleagues have echoed that same thought, really. It must go further. And speaking about the breakfast clubs, that's excellent, 30 million into breakfast clubs. The government are sort of pinning the breakfast clubs with the child poverty strategy. And whilst breakfast clubs are very important, they're not going to end poverty in this country. They're not going to end children being in poverty. The government need to scrap the two-child benefit limit. The government are pursuing a sort of growth agenda, an economic growth agenda, and that's not going to be possible when there's so many people in the country living in poverty, which is really damaging to the economy. So yeah, it needs to go further.
Thanks very much. And I think certainly at the Food Foundation, we're looking at the Child Wellbeing Bill, which we're expecting to come up later this year, as an opportunity to, particularly some of the points that Stephanie raised around kind of auto-enrollment and standards, trying to kind of embed that in other opportunities. It's not all about the budget, although I know that's a very important part of the political process. So moving on, I think I'm going to combine the two questions that we have, just as I'm conscious of time. So I think two things, or two final reflections that it would be great to hear from you all on, is whether or not, or what you think the kind of immediate threats or challenges are in terms of actually progressing policy in this space. Is there any kind of big barriers that you see, but also one opportunity that you think is kind of coming up in this area? Let's try and be positive and finish on a positive vision. Where do you sort of see that biggest opportunity in the next, let's say, 6 to 12 months with the new government? So I'm going to go in a slightly different order. Should we come to Adam, as you didn't comment on the budget just then, and then we'll go around. Thank you.
Thanks, Hannah. And it's difficult to distill this into a single threat and a single opportunity. I think from if you're looking at this through the lens of health and public health, I think we remain threatened by being drowned out by the NHS on fire rhetoric, and that swallowing up narrative around long-term decision making. I hope I'm wrong, but we're going into winter. It was an NHS budget, if being quite frank. It was a budget that kept the lights on in the NHS through to the spending review in the spring, and it wasn't one that focused on this long-term public health challenges. So now we're hoping that that's in the more multi-year approach that might happen with the spending review next time around. But that said, the opportunity from a broad mission-based approach cannot be underestimated. It's really heartening to hear government coherently talk about the role of different departments have in improving population health and in tackling inequalities, that there needs to be a coherent approach across those departments, and that if we're going to meet economic growth ambitions, then health is going to be a core part of that. So I think that idea that this challenge is multifaceted, that everybody has a role to play, and let's do it in an inclusive way, for me, is a really valuable opportunity. To really land that is then the challenge, and that's where I think some of the internal mechanics of government are going to be really important, alongside getting the individual policies that colleagues on this call will be all too familiar with, having those in place. Thanks.
Thanks very much, Adam. I'll go to Stephanie now, if you have a reflection on a challenge and an opportunity.
Yeah, I do. My biggest challenge, so let's assume that government agrees with us that 900,000 children living in poverty not getting a free school meal is a bit rubbish and we could do better, assuming they understand that. Assuming we get to auto-enrollment so every child that is entitled gets a free school meal, we really need to crack on with quality. We need to crack on with compliance with the standards, monitoring to make sure that that money invested ends up in good nutrition, because right now there's no guarantee. There's some brilliant work going on, but we want equity across the system. And we don't want school food the narrative of school food to be really terrible food served in schools getting onto the BBC News. That is not good for children, it's not good for families, it's not good for schools, so it's not good for our cause. So we need to really, really focus on standards. So that is the threat. The opportunity, as you say, Hannah, child poverty strategy, children's wellbeing bill. I mean, surely food has to be front and centre. You know, we want children to reach their potential, and to do that, they need good nutrition so they can be ready to learn.
Thanks very much, Stephanie. I will go to Vicky now, and then we'll end with Laura.
Thank you. So in terms of a threat or a barrier, I'm still concerned about how government can reconcile a pro-business agenda with a pro-public health prevention agenda. And I agree with those opportunities, and it's nice to, in a positive note, see that there's a number of them that the other panelists have put forward. And I would like to, I think, acknowledge the fantastic opportunity that the House of Lords inquiry report brings to the table. And sorry, because I was only allowed one, but also the Competition and Markets Authority interim market survey report specifically in relation to infant feeding.
Thanks. And Laura?
Yeah, so I won't talk about the two-child limit again because I think you all know my position on that. But I think one of the barriers to sort of helping families, children, anyone who's experiencing poverty accessing nutritious food is as I've said, the sort of local welfare funding. I think a big barrier is generally funding to local authorities. We know the dire situation that local authorities are in at the moment, with more and more declaring bankruptcy or reporting that they're on the brink of bankruptcy. Local authorities need adequate funding to be able to support their residents, and poverty needs to be a priority in that. So I'd say that was a barrier. I'll try and end it on a positive, but Stephanie mentioned the child poverty strategy. It's really positive in general that we've got a government that are speaking about poverty. They're using the word poverty and they're committing to addressing poverty. It's really positive that they're engaging with organisations, with localities, with people who are experiencing poverty to develop this strategy. And there are some opportunities there that, you know, they've committed to doing it in the spring, and that they're very much working hard on it. You know, we're in contact with the child poverty unit in government. So it really does present some opportunities for some of this stuff to be worked through. I will just also say that none of us, I don't think, have touched on is the sort of opportunity for devolution of powers to combined authorities. Combined authorities are massive in this sort of anti-poverty space, and increasingly becoming more important. There's excellent work being done in the North East with Kim McGuinness committing to a child poverty unit up there. We're based in Greater Manchester, and there's some good stuff going on in GM as well. So there's opportunities there with what the mayoral authorities can do. Working with government as well, which is really positive. So hopefully I've rounded us off in a positive manner there. Thanks, Anna.
Thank you very much, all. And I think, yes, certainly it's good to be sort of focusing on those opportunities. I think there are a lot of opportunities, and now it's down to kind of all of us to kind of be bold in our asks and really make sure that we seize all those different opportunities across these various agendas. So I've almost kept us to time. If we were in person, I think there would be a round of applause now for our panelists. Thank you very much for joining us today. To end this session, I'm just going to hand over to Chris from Nifty Fox, actually, who's just going to talk us through his lovely diagram that he's been drawing as we've been talking in this session, and then we will finish up for a short break before the second session starts. So Chris, over to you to talk us through your lovely pictures.
Thanks, Hannah. So when we started the first session covering why have obesity-related policies in the UK failed, there was these 4 key takeaways. So the first, that policies are generally not joined up. So there might be policies that actually conflict or undermine each other. That we have this kind of siloed way of working with 16 departments, each with their own policy-making priorities. So that kind of causes the conflict as well. And then this lack of a long-term vision. The policies don't address the cause directly. So there's issues of affordability. There's the sort of family dynamic that was discussed, where food becomes sort of like a quick way to spend time with your family and to give your family the things that they need or want. If you can't afford another kind of family experience. And then there's not addressing the causes of like high sugar items not being taxed. They don't address the context specifically, so that some interventions don't feel equitable. People saying that Healthy Start doesn't feel like it's for them. And then also that the policies themselves aren't always enforced. So we have the photography that was shared of the shelves being full of high sugary foods, when they shouldn't be. And with the new government and the new opportunities that we've got, so food, health, and diet are being prominently discussed in the media, and there was energy drink bans for under 16s, the commitment to primary school breakfast, which we just heard about, and then the mayor's commitment to banning outdoor advertising. So seeing more like power in local government and having local action. And then we've got also just wanted to highlight the Food Foundation reporting, which I'm sure will be linked after this event, so you can read up on that. And just quickly to pull out each of the sort of takeaways from the panel. So the first steps, it was the publishing of the voluntary baby food guidelines, so that the early years diets, which track through to adulthood. For school food matters, it was the 3 points of access to food in schools funding. So the cutting of quality is a result of the cutting of costs, and then increasing the standard, and including breakfast as well. For Resolve, we've got the extension of these local welfare assistance schemes and to support people with cash primarily, so that they have more autonomy over the food that they buy. They have the dignity of being able to choose the food that they want and that they need. And the dietary requirements that they might have that are limited in food banks. And then finally, addressing that it isn't all about personal choice, and the primary thing that will make a difference is tax and regulation on things like soft drinks, maybe to be extended to foods, and then the amount of unhealthy food advertising that we see outdoors, and the restrictions that could be placed on that. That's a very quick overview, Anna. I'll hand back over to you.
Thanks very much, Chris. That's a really good summary, and it's really nice to see when we've covered so many issues in quite a short space of time this morning to have it kind of summarised there. Hopefully these will get shared with everybody, so you'll be able to kind of use it as a shorthand reflection of everything that's been discussed. So I'm sorry I've taken additional 2 minutes of your break time. We will be coming back at 11:20 for the second session, where we'll be focusing on more some local case studies of action across some of the issues we've talked about this morning. So we'll see you back at 11:20, and thank you very much for joining this morning. And a big round of applause for our panelists again.
Okay, colleagues, welcome back to session 2. My name is Matthew Ashton. I'm the Director of Public Health for Liverpool and the Lead Director of Public Health for Food Active. So a quick recap. As part of session 1, we focused on the failure of obesity-related policies in the UK and also the opportunities really around the new government, but with an already very busy work programme across all areas of government. And then some particular gaps which could also be framed as opportunities highlighted, including making the first steps really count, thinking about the importance of school food, critical issue of resolving poverty, and then the role that tax and regulation have to play. What we want to do now is shine a light on what local areas are doing to try and mitigate those gaps in current national policy. For example, as people know, the government failed to announce extensions to thresholds to important schemes such as free school meals and to Healthy Start in the latest budget. So in the absence of those much needed extensions, we will hear from 2 fantastic case studies in Middlesbrough and in Liverpool to find out how they are taking steps to ensure that those who are eligible can actually reap the benefits. And we will also hear how Lancashire's catering services are working to support schools and to meet the school food standards, and also from Cumberland, whose License to Grow project is helping to increase access to healthier food. But first of all, absolutely delighted to welcome our second keynote speaker, Professor Charlotte Hardman, who is a professor of psychology of eating behaviours from the University of Liverpool, who is going to help us set the scene for session 2 by reviewing the current inequalities in access to healthy food and how action can be taken at a local level. We will have time for questions shortly, so please do pop any questions you have for Charlotte in the chat and we'll come to them at the end. But over to you, Charlotte. Thank you.
Thank you very much, Matt. It's a real pleasure to be here talking to you today. Thank you very much to the organisers for inviting me, and thank you to all of the attendees. So I will start by sharing my screen. Let's just get that into... So hopefully that's in a PowerPoint screen show view. Just shout if not, please.
We can see that, Charlotte. Thank you.
Great, thank you. Always good to check. So I'm going to be setting the scene for this second session, continuing really our discussion of inequalities in access to healthy food. So I will start by providing an overview of the inequalities we see, some of the reasons for those, and that will be building on some of the content that my colleagues have already beautifully presented earlier this morning. And then in the second part of my talk, I'll be moving on to thinking about how action can be taken at local level. And I'm just going to give 3 illustrative examples of some of the work I've been doing in collaboration with colleagues both here in Liverpool and further afield. Of course, these are just 3 illustrative examples. As we know, there is a huge amount of fantastic work going on locally, and I'm really excited to hear from the subsequent presenters and to hear what everybody else has been up to. So we've already heard a lot so far about the existence of dietary inequalities. And I think just what this slide shows, so this is actually showing evidence of persistent inequalities. And this is in purchasing of fruit and vegetables over a 15-year period. So what we're seeing here is that consistently, it's the households in the lowest 10% of income who are purchasing less fruit and vegetables per day relative to more affluent households. And I think just what's important to note here is just the persistence of this. So dietary inequalities have been around for a long time. And I think the fact that we're not really seeing a lot of movement here does speak to some of the issues with existing policy, as we've already heard previously from Christina. Now, of course, another enormous issue that we are grappling with is this issue of food insecurity. So food insecurity refers to a lack of secure access to sufficient amounts of safe and nutritious food for normal growth and development and a healthy, active lifestyle. It's a major issue across the world, but even in developed countries like the UK, where in 2022, it was estimated that 7.3 million adults were living with food insecurity. So that equates to 14% of households in the UK. And we're really concerned about food insecurity because of the impacts it has on people's health, their well-being, and development and general quality of life. Two key things to note about food insecurity. In developed countries like the UK, we're not talking about access to food per se. This is specifically in relation to access to healthy, nutritious foods, the foods that we are recommended to consume for healthy lifestyles. And I'll talk more about why that is in just a moment. The other thing to say about food insecurity is it's on a continuum. People can experience mild food insecurity where they're worrying about having enough food. In more severe instances, people start to cut back. And in the most severe cases, people are actually going without food, sometimes for a whole day or more. And people are having to use food banks and other sources of food support. So I think it's just important to clarify that food insecurity is not just using a food bank. Food insecurity can range in its severity, and it's important that we can take that into account when thinking about interventions and policies. So this slide just shows the profound impact of the cost of living crisis on food insecurity. So we'd already had COVID, which we know had significantly exacerbated levels of food insecurity. And then with the cost of living crisis, this caused levels of food insecurity to rocket up to 25% of households with children in September 2022. So these are data from the Food Foundation and City University. And then we also saw this reflected in diet quality. So again, in this same piece of research, it was shown that it was the households experiencing food insecurity who were much more likely to report cutting back. And particularly, they were cutting back on the healthier foods, the fruit, the vegetables, and the fish. So this really is showing sort of the extent of these inequalities, and it's the less affluent households who are really having to make these changes, which ultimately could impact on health. And then we also see these inequalities represented in wider health, but particularly in prevalence of obesity. So I believe Christina had already presented quite a similar slide here, but this is the data from the most recent National Child Measurement Programme. So this was actually released only last week. And what this really shows is the continued inequalities that we see, with more deprived children significantly more likely to be living with obesity. We can see there was a real peak during the COVID-19 pandemic, where there was in fact a 12.5-point gap in prevalence estimates between most and least deprived deciles. And although that has narrowed since COVID, we can start to see some evidence of an increase in levels of childhood obesity seen in that most deprived decile, which is of concern. And then, as we heard from our local news here in Liverpool, what these data actually showed is that it was Knowsley in Merseyside, which was top of the list in terms of levels of overweight and obesity. So in Knowsley, these most recent estimates suggested that almost half of 10 to 11-year-olds are either living with overweight or obesity, and this was the highest proportion in England. So I'm going to spend a bit of time in the next few slides really trying to reflect on some of the reasons for why we are seeing these striking inequalities, and therefore what can we do about them, essentially. So this has already been mentioned several times during today, because it's such a key issue. The affordability of healthy diets is absolutely fundamental. If you are not able to afford the foods that are recommended for a healthy, active lifestyle, then essentially what are you supposed to do? We already know from the Food Foundation's work, for example, that on average, healthier foods tend to be more expensive, 3 times more expensive in some cases, calorie for calorie, than less healthy foods. The slide, the graph that you can see there on the slide, this comes from the National Food Strategy Independent Review, which was published a couple of years ago. I'm sorry that some of the text might be a little bit small at your end, but essentially anything to the right of the dashed line is foods that are classified as high fat, sugar and salt. So these are the types of foods that we should only be eating in moderation. So things like processed meats, chocolates, crisps, confectionery, biscuits, all of that sort of thing. To the left are generally our fruits and vegetables. And what you can see is this very sort of marked trend whereby everything to the left is more expensive per calorie, pretty much, than the foods to the right. So what this does suggest is that if you're struggling with finances, with budgets, with the cost of living crisis, it is the sensible economic choice to shift your food purchasing to those foods on the right. And there's a lot of evidence that coming out recently that this is a choice that people are having to make, even if it might conflict with their own personal health or other food motivations. Another really important issue that works alongside affordability is accessibility of healthy foods, because if there is nowhere in your local area to be able to acquire and purchase these foods, then this is also very likely to impact on your diet. So food deserts are areas where there is very poor access to healthier foods. It might be that there are no large supermarkets in the local area, and there might be a preponderance of sort of smaller convenience style shops, which will often sell a lot of pre-packaged processed foods and not very much fresh produce. The existence of food deserts has been supported by a lot of research. Just an example on the slide is a study from a deprived area in Glasgow, where it was shown that so-called environmental bads, so these are things like outlets selling alcohol, fast food, tobacco and gambling, were tending to cluster together and co-locate in more deprived areas. And we see this across the UK and in other countries. The Priority Places for Food Index is a composite index that was launched a couple of years ago, and this compiles data across different dimensions that relate to food insecurity risk. And it helps to identify neighbourhoods that have a lack of accessibility to healthier and sustainable sources of food. I mentioned Knowsley just a moment ago around the high levels of child obesity. And according to this index, Knowsley is actually the second highest ranking constituency in England in terms of needing support with low income, fuel poverty and food support. So, and this is likely due to because in Knowsley there are relatively low levels of nearby supermarkets, so affordable food may be particularly hard to find locally, and access to online shopping deliveries was also found to be low. So some of the work that we've been doing at the University of Liverpool via a collaborative project called FioFood is focusing more on individual experiences of food insecurity. And we've been particularly focusing on people living with obesity. So in this study with over 500 participants, what we've shown here is the range of barriers that people who experience food insecurity are having to deal with in terms of trying to consume a healthy diet. So some of these barriers are things we've already talked about. So barriers in the food environment, price, transport and distance. But there are also barriers within individual households, which Christina mentioned in her talk. But these would be barriers around preparing food, having enough time to shop and time available to prepare and cook food. But another really sort of key set of barriers which were revealed in this study are barriers around personal health, particularly physical and mental health, because for people who might be living with physical or mental health conditions, this can significantly impact on their ability to purchase, prepare fresh food. And we also, in this study, revealed the existence of stigma. And this was stigma around being food insecure, which did also act as a barrier in some individuals, because the sort of the stigma and the feel of being judged was actually, in some people preventing them from reaching out and accessing food support. We also found in this study that our participants experiencing food insecurity did rate themselves as having lower knowledge about a healthy diet. However, this is not consistently found. It's likely that knowledge is going to be important, and it's very likely that actually at a population level, we could all do with better knowledge about what's healthy and the sorts of foods that we could be consuming. But what's really important to understand here is that poor knowledge is not a main driver of food insecurity. because you could have all the knowledge and education that you could possibly have, but if you were not able to afford or access those foods in your local area, then you're not going to be able to consume them. And work that we've done and others have done consistently shows that when you go and talk to people in food banks or pantries, for example, people know that they should be consuming 5 portions of fruit and veg. But it's really then about how people are able to afford and access those foods. And just to give another example from this research, which I think again complements nicely some of the things we've heard already, we asked our participants to say what would be most helpful to you when you're out shopping to help you increase healthy food purchasing. And pretty much what came out really clearly was people said they wanted help with affordability, price discounts, money off promotions, rewards on supermarket loyalty cards, that sort of thing. And the interventions that were rated as least helpful were all around things like labelling and education, which again just speaks to this point around education is not going to be enough. We need these holistic approaches that tackle the structural issues that are preventing many people from accessing healthier foods. So just to finish off now, I'm going to end with the sort of examples that I wanted to give of local action. The first example I want to talk about is a project called Bean Meals, which is around transforming school meals using UK grown beans. Of course, we've already heard a lot about this transformative potential of investing in school meals. So this is really a great opportunity for us to be able to reach very large number of children, and including those experiencing inequalities through free school meals. So Bean Meals is a collaborative research project. It's researching systemic innovation in the food system. And the work that we were involved in was to try to understand how to get healthy, sustainable foods into primary schools. So to do this, we focused on 2 novel common bean varieties called Capulet and Godiva, which are navy beans and blonde kidney beans, respectively. Now, what's new and interesting about these beans is that they have been pioneered by our colleagues at the University of Warwick to be able to grow in the UK. Normally, these sorts of beans would be imported from North America. So we have here a food ingredient with lower environmental footprint that's quick cooking. It's healthy. So there's a lot of potential here for getting this healthy, sustainable food ingredient into primary schools. To do this, we conducted place-based research in Leicestershire County and Leicester City in collaboration with our local authority colleagues and with several different universities and other partners. So the research project has just finished. We will be sharing findings in the next few months, but we worked with 6 primary schools. They were very diverse schools in Leicester and Leicestershire County. We got the beans onto the school menus. The cooks presented them in lots of different ways: bean pizza, homemade baked beans, for example. But crucially, we also ran a programme of bean-based education and staff training, which was delivered in collaboration with Food for Life. And we found that was really important in terms of piquing the children's interest. So they learned about the beans in the classroom. They played a tabletop game, which was all about the story of where beans come from. And we found that really piqued their interest. So then when they went into the canteen and the beans were on the menu, they were like, well, I've learned about this thing in class, so now I'm really curious and I'm more likely to try it. So we found that this whole school approach was really fundamental and important. This was a really interesting approach for us as researchers. It's a great example of a collaborative project of researchers, local authorities and schools working in partnership. And I think we all learned a lot from working from each other. We learned about what's possible, but we also learned about the many barriers. But I think there's huge potential in this sort of partnership working and benefits for all parties. And just to give one example of this, so Leicestershire were recently successful in achieving their Silver Sustainable Food Places Award, and their collaboration in Bean Meals was particularly mentioned as a very strong example of why they got it. So just another example I want to highlight is the wonderful Queen of Greens fruit and veg bus, which works here in Liverpool and Knowsley, delivering fresh, affordable fruit and vegetables to some of our most deprived communities. What's great about Queen of Greens, again, it's a partnership between Feeding Liverpool, Feedback Global's Project Alchemic Kitchen, and also working with Liverpool City Council and local NHS partnerships. But they're also working with Alexandra Rose, who provide fruit and vegetable vouchers. And I just think this is such a nice example of a joined up approach, because they're addressing affordability with taking the fruit and veg bus into these food desert areas, but they are also, they're addressing access, is what I should have said then, but they're also addressing affordability by accepting both Healthy Start cards and Alexandra Rose vouchers. And we know from the work that the team are doing is that they are really having a clear impact on the diets in the communities who are served by the fruit and vegetable bus. I think then just moving on to the final example, which I want to highlight, is the potential for growing more fruit and vegetables in some of our urban areas, particularly some of these food desert areas. We did a piece of research a few years ago where we modelled this, and we were able to show that if we used all the green spaces in some of our towns and cities in Great Britain, we could actually grow 4 times what we currently domestically produce and import when we're talking about UK grown fruit and vegetable categories. So this would be enough for, in these various towns and cities, for everyone to be able to consume 5 portions of fruit and vegetables per day. Now, of course, this is an upper estimate, and we're not suggesting that we should use all land in towns and cities. We obviously should not plough up parks to grow potatoes, but this does speak to the potential for using more of our green spaces in areas close to where people are living. And sort of in view of this and of the evidence supporting the potential of growing food in towns and cities, we've set up the Liverpool Food Growers Network, which aims to support food growing projects across the city region. So we particularly want to connect different community growers to increase the amount of fresh fruit and vegetables that are being grown. What's important to note here is we're not just talking about private allotments, we're talking about community projects in some of our most deprived areas where communities are coming together to grow food in a very holistic and supportive way. And this is showing benefits not just to diet, but also to things like well-being, social factors, and community cohesion. Now, I know I'm short on time, so I'm just going to skip through, but I know we're going to hear about Right to Grow shortly, so I will skip through this slide. Yeah, just my take-home messages, really. I think what we're hearing about today are the multiple barriers to consuming healthy diets and the need for interventions to address issues of access and affordability. I think what we can see today from the work that's going on is that a different, healthier and more equitable food system is possible. And there are many promising opportunities for local authorities, for example, to work with schools and with local communities to increase access to healthy, sustainable foods for all. But a real sort of one of the main barriers we're experiencing here is the local investment, and we badly need that local investment in order to realise some of the great opportunities that we have in this space. So thank you very much for listening. I will stop sharing just now, and thank you.
Charlotte, thank you so much for your excellent presentation. I was particularly struck by the affordability slide. Found that particularly powerful, and also you raised that really important factor of stigma in food insecurity. If you could just stop sharing your screen, that would be really helpful.
Oh gosh, I'm
still
so
showing on
sorry.
screen. And also from a Liverpool perspective, great to see Queen of Greens on there. Big fan of that project. So thank you so much. Delegates are posting Q&A questions in the chat, which is great. Please carry on doing that. We'll have some time to come on to those in a minute, and we'll capture all the questions and come back on them anyway. So we are now going to move on to our series of case studies to highlight some of the great work happening across the Food Active network. And starting with Anne Rose, who is a health improvement specialist from Public Health South Tees, Middlesbrough Council. And Anne, you're going to share details of Middlesbrough's approach to auto-enrolments in free school meals. So over to you, Anne.
Can everyone see my screen okay?
That's great,
Yeah,
thanks.
got that.
Fab. So good morning, everybody. My name's Anne Rose. I'm a health improvement specialist working for Public Health South Tees. And I'm here to talk to you about the auto-enrolment pilot that we undertook in Middlesbrough. So just to kind of talk you around the background to why we started the process. We're involved in public health with working with schools on the Eat Well Schools Award, which is a whole school approach to healthy eating. And within that, we include promoting the uptake of free school meals and universal infant free school meals within schools. So we put a proposal together, which we submitted to the council to look at auto-enrolment of free school meals. And this was following a webinar that we attended with Fix Our Food. So we had a look into the kind of the background work with auto-enrolment, what it undertakes. And we had some really good discussions with the Sheffield City Council, who are kind of one of the leading authorities on auto-enrolment. And following that conversation, we then signed up to the Fix Our Food auto-enrolment toolkit. So if anybody is thinking about undertaking auto-enrolment, I would strongly suggest that you get in touch with Fix Our Food, because the toolkit that they have is based upon all of the processes that local authorities have undertaken with auto-enrolment. So there's example documents, letters, and then there's this brilliant process flow which takes you through each stage of auto-enrolment and what you need to be thinking about at each stage. So we had the subsequent meetings with Sheffield City Council, who were amazing at sharing everything that they'd learned through the process that they'd undertaken. And as I said, they shared a lot of their documentation, such as the data protection impact assessments, the letters that they used to send to households, and the work that they did with schools as well. So we then met with our deputy mayor, who was in agreement to pursue this further, and then that led to us developing a report that went to executive. We didn't really have any indication on the numbers that were potentially missing out on free school meals. We did undertake a small sample of around 60 households, and it was around the 10% figure of children that were potentially eligible that were missing out on free school meals. But obviously, because of the levels of poverty that we have in Middlesbrough, we felt that the numbers would potentially be quite high. We were also critical to implement it this year because of the transitional protections ending in March 2025. So it would mean any children registered for the free school meals this year would continue to get that until the end of their phase of education. So it was really critical that we try to implement this year. So following the agreement to proceed, we felt like we had plenty of time to implement the pilot. However, the timescales very, very quickly went by. But the timescale was tight because your deadline that you're working towards is the October school census. And that's because that triggers the pupil premium money coming into the schools. So we got the various bits of approval and we undertook the process starting in June. We met with schools, so we discussed proposals with them because we needed to get buy-in from the schools. And immediately an issue was identified that maintained schools we can sign up, but for other schools who are not maintained, you need to get permission from them. So we ended up undertaking face-to-face meetings with schools, and as a result of that, we had 100% of schools sign up to be involved in the pilot. In terms of the process, our residents and business support, revenues and benefits team, we're also working on other transformational projects for the council and felt that they didn't have much capacity to proceed with this. So we gained agreement from our Director of Public Health to free up some staff time to support with the process. In the end, we didn't actually end up needing that much staff time to work with the revenues and benefits team, and that's just because we found ways that saved us a huge amount of time around kind of the administration of it. We developed a project team from the very beginning, and this was crucial to have those regular meetings. We had 2 meetings a week, every week, and it was making sure that we were working in collaboration across the various different council departments. So we had resident and business support, which is revenues and benefits, public health, we had a data and analytics team, education, data protection, legal, marketing, communications, and also finance. And it was really key that we had everybody around the table because everybody offers various different levels of expertise within their own work areas. The proposal that we put into the process was to extract council tax reduction data from the benefit system. And that would give us an indication of pupils that are potentially eligible for free school meals. Our data and analytics team Their involvement was crucial. They developed through their software that they have some scripts that would identify the pupils and do a lot of that cross-referencing against the school census for us. And that also allowed us to split the data up even further, which reduced the need for more work to be undertaken. In terms of the information and lessons learned, we had really strong presence and support from our data protection team around it being having the lawful basis to undertake the process and making sure that we built into the process in terms of parents, carers having the right to object with their data being processed. As I said earlier, the initial contact we had with schools was via email, but we didn't get much response from the schools. So we actually set up a specific meeting with the schools, explained the process to them, what the benefits were to them as a school in terms of maximising pupil premium funding, and that led to 100% of the schools being involved. We were also quite tight on timescales with schools because we were also coming to the end of the academic year in the summer. So that face-to-face meeting was a huge bonus for us to get that in place and get the buy-in from the schools. As I said earlier, it was also important for us to meet the deadline with the transitional protections. So that would mean that children would have the free school meals until the end of their phase of education. And the pupil premium money would also be secured for the schools going forward. We undertook auto-enrolment as a pilot, just to see the processes, how it would work, how successful it would be. And also we offered it free to the schools. So there was no service fee for them to be involved in the pilot at all. And as I said, it was just really important to have that whole team assembled from the start. If we'd have had to kind of pull people in as we went, I'm not sure it would have been as successful. So if you are thinking about doing it, definitely scope out the different departments within your local authority as to who should be involved in this project. Excuse me. So in terms of outcomes, we actually had no parents or carers opt out. So 100% of people that we contacted, we ran their data through the system. So there were 799 children that were identified. 630 of these were deemed to be entitled to free school meals. The rest that weren't deemed to be entitled, we found that this was due to parents, carers transferring over to universal credit and fluctuating wages in terms of not being eligible at that time that we did the check. So a lot of those checks are still continuing to be done, and there will be a number of these that have actually now gone through and will now be entitled. So looking at the numbers that are entitled, it's going to generate approximately £800,000 of pupil premium money to Middlesbrough schools. So that will obviously help them in various different ways with school budgets and what they can spend that on. And then we averaged £400 per year. That would be roughly what a parent or carer would pay for one child for a school meal for the year. So across Middlesbrough, it's £252,000 of savings for families. And when we talk about poverty and having more, cash in your pocket, that's a huge amount of money to families in Middlesbrough. It also meant that we've increased the number of children and young people that have access to the HAF programme. So again, trying to reduce that holiday hunger. And we've also had more families accessing the Household Support Fund because children are now entitled to free school meals as part of that criteria. They've been able to access some additional funding. It's been a positive cross-council collaborative working, and we are actually looking at possible other auto-enrolment projects such as the Healthy Start scheme. And it's also got the revenues and benefits team kind of thinking about how can they ensure that the families that are entitled to various different welfare benefits are actually receiving them. So there's a lot more proactive work being undertaken. And then there's also been a lot of positive press for Middlesbrough Council around auto-enrolment. And if you've not seen it, there was a good clip from BBC Politics North where various politicians were discussing auto-enrolment and the need to make it national policy. So in terms of next steps, we're currently looking at recommendations of how we can take auto-enrolment forward, so it becomes kind of business as usual. We're consulting with schools on those proposed recommendations. We do intend to follow up with schools looking at the actual uptake rate of free school meals. So whilst children might be entitled to free school meal, actually how many of them are having the school meal. And that might allow us to get into the schools and do some more work with them around the Eat Well Schools Award that we have. So as I mentioned, that's a whole school approach to healthy eating. And we make sure as part of that the school meals are compliant with the school food standards. So we support schools to get the meals compliant, and then also looking at leadership and culture within the school around healthy eating and education and training as well. And then, as I said, we're also going to be looking at the feasibility of other auto-enrolment processes such as the Healthy Start scheme. And that's me. Thank you very much for listening.
Anne, that's fantastic. Thank you so much. If you could stop your screen sharing. So that's amazing to listen to. 630 kids, 800,000 benefits to schools, £250,000 savings to families, and a blueprint for working together across the council. What's not to like? Well done, Anne. That's fantastic. So again, delegates, any questions in the Q&A, and we'll pick up at the end. Moving on to our next case study, delighted to introduce Liz Fisher, Senior Public Health Practitioner with me in Liverpool City Council, to share details about how we are working together to increase uptake of Healthy Start vouchers. So Liz, over to you.
Thanks, Matt. So hopefully everyone can see my presentation there. So I'm just going to cover our approach to Healthy Start in Liverpool, some of the key stakeholders that we've involved throughout this journey, barriers and solutions to increase uptake around Healthy Start, and some key learnings and reflections. So in terms of Healthy Start, in 2022, Feeding Liverpool, who lead our local food alliance, undertook some survey work and some research into feeding into Healthy Start in terms of the current level of understanding and awareness of Healthy Start in Liverpool, why uptake isn't higher amongst eligible parents and carers in the city, and how we can improve take-up across the city and what is needed to deliver this. And this was done through a range of focus groups, conversations, questionnaires, case studies. The report was launched in September 2022, and there were 5 local recommendations that were given through the report. This was local management and coordination. So there was a lack of local coordination or a city strategy, as it seemed at the time that Healthy Start was no one's job, and that coordination of Healthy Start, training and workforce development. So there were significant gaps in knowledge amongst parents and professionals about the scheme and changes to the scheme. Vitamin uptake was the least well-known element and least promoted element of Healthy Start. Marketing and communication, so there was a lack of strategic communication, there was out-of-date materials being promoted, and there was no kind of localization of those materials. And system monitoring and quality assurance, so looking at the data and how we can look at a baseline for the data, reporting mechanisms, and monitor the impact. So in December 2022, we started our Liverpool Healthy Start steering group. And you can see on the screen there, there's a wide list of partners who attend that group. We meet on a quarterly basis, and there's a range of partners around the table. And we've developed a shared action plan when we're around the theme of the 5 recommendations that I mentioned on the previous slide. And each partner takes ownership of their actions within that action plan. So developing those actions, actually delivering and undertaking those actions, feeding back progress on their actions, and also raising any issues to the group so that we can look to resolve them as a collaborative approach. We started looking at data, which I know many of you that are aware of Healthy Start, the data is really challenging. So we knew that was a significant amount of money in Liverpool went unclaimed in 2021. And the last data we could access at the time was in March 2022, which was as it changed from the paper-based voucher to the digital voucher. So our uptake then was 73%. And then as that transition occurred, there was no data available until January 2023, when the data started being published again and confirmed what we had anticipated, that as that transition had happened, our uptake had dropped from 73% to 65%. So there was a lot of work to be done. So we looked at the different challenges, both from the Feeding Liverpool report, but also feedback from partners in the steering group. And these were themed into 3 areas. So one was the application process. So we knew that digital exclusion was challenging in terms of people actually applying for the Healthy Start scheme and not having those means to apply, whether that was data, the equipment to do so, the access to the internet. There was an inability to complete the application process. So the application process isn't the easiest to complete, and we have low literacy rates across the city, and it was a real challenge to support people to undertake that application process. And having to reapply once the baby is born, which I'm sure is the last thing on anyone's mind once they've just had a baby, is how do I reapply for my Healthy Start vouchers? Awareness, so reluctance to use the cards. So people were concerned that they were being monitored and the government could see what they were buying with those cards. People were unsure where they could use those cards. And some people didn't want a credit card. There was a lot of misconceptions around the transition from the paper-based vouchers to the cards. And knowledge and awareness of the scheme. And this was both with potential eligible residents, but also with staff and professionals in terms of changes to the scheme, and some of the finer details, such as the names that are on your universal credit application, need to be the exact same names that you put on your application for Healthy Start. And eligibility and access. So we have complex cases that were being rejected and people didn't know how to appeal those cases. People with no recourse to public funds. So a lot of challenges in terms of some that are eligible and some aren't eligible, and changes to the benefit systems as well in terms of those transfer of legacy benefits onto universal credits. So based on these three areas, we've developed some different interventions. In terms of the application process, we now have over 200 community Healthy Start champions across the city, and they're supporting to raise awareness of Healthy Start, but also support people where they can to actually undertake and complete that application process. We've had questions raising awareness of Healthy Start embedded within assessment. So, for example, Liverpool Women's Hospital, Alder Hay, some children's centres, Citizens Advice Liverpool, and more recently, some of our housing associations have embedded those questions, especially the finance teams who are working with residents who are in arrears, and this potential access to the Healthy Start vouchers could support in them, obviously accessing fresh fruit and veg, but also reducing their, increasing their income, which could support with their arrears. And also Citizens Advice Liverpool have a dedicated member of staff who will support people with those application processes if some of the staff and professionals that are having those conversations don't have the time to do so. In terms of awareness raising, so we've got pop-up banners and we've distributed leaflets. We undertook last year a coordinated media promotion, and there's a lot of information and media images available on the Healthy Start website. And we themed those, and different partners promoted ones that were more pertinent to them. So, for example, the Health Visitors Children's Centres Liverpool Women's Hospital promoted the ones that were focused around pregnant women and children. The City Council and Citizens Advice Liverpool promoted the ones that were focused more around, do you receive universal credit or get help to buy? And Feeding Liverpool promoted ones, for example, around you can get help and what good sources of food to help your child grow, so that we were targeting a range of audiences across a range of partners. Some of the feedback from the partners and the professionals in the steering group as well was that badges would be useful. So on the Healthy Start website, there are stickers, and we had those stickers turned into badges. So you can see 2 of the badges there that the staff will wear as the to promote the scheme. And we've also done a lot of training and presentations as well, to team meetings and presentations to raise awareness across the city. And eligibility and access. So we have a single point of contact with Citizens Advice Liverpool. So those cases that are rejected and people are not quite sure how to overcome that and appeal that, we can refer people to Citizens Advice Liverpool, who will support people in that journey. It was mentioned earlier about community food spaces and the Queen of Green. So now we have 80% of our community food spaces across the city accept Healthy Start cards, and we now obviously have the Queen of Greens that stops at over 40 stops across the city and Knowsley, and that's supporting to increase accessibility and encourage people to use their vouchers. And the Queen of Greens targets food deserts, which obviously is an issue in terms of accessing fresh fruit and vegetables. And we've also developed Healthy Boost. So this was to support families who have no recourse to public funds, kinship carers who have challenges in applying for Healthy Start vouchers, and also those people that are on that threshold but don't quite meet the eligibility for Healthy Start. So we have that at a local level, utilising the Alexandra Rose vouchers, which were mentioned earlier, and the Queen of Greens mobile greengrocer. In terms of some of our next steps, so we're looking at the data. what data can we get at a more local level so that we can map this across the city and look at some targeted interventions in low areas of uptake. Increasing that awareness raising. So again, we're looking at working with our registrars who obviously register all the births across the city, and other key partners what we can raise awareness with. Didn't mention earlier, actually, we have a video that Feeding Liverpool have developed, and that video it's got local professionals in it, but also local people who are currently using the Healthy Start scheme, and we're sharing that across the city to encourage uptake as well. Increasing retailer participation and awareness, so looking at where we might not be covered and where we can increase that retail participation. Increasing the number of Healthy Start champions, and then is there something we can do that's coordinated across Cheshire and Merseyside to raise awareness of Healthy Start in that kind of broader footprint. And then finally, just some key learning and reflections. So a Healthy Start specific steering group is really important when looking at Healthy Start. So having a variety of partners around the table, but encouraging those partners to take ownership so that everyone's taking ownership of their own actions and it's not landing at one person's door. Continuous awareness raising and training, so that coordinated promotion so that everyone is promoting at the same time and reaching that larger audience. Consistent messages, there's still a lot of confusion around eligibility, so it's just ensuring that everyone is passing on those same messages. And reframing the language, which I think was touched upon earlier by Christina, in terms of it's not always viewed as a benefit and people struggle to understand that it doesn't affect other benefits, for example. Just reflections, the data issue nationally is still challenging. We know how many people are signed up to Healthy Start, but we don't know how many people are eligible, so it's really difficult to monitor now the uptake on that until that issue is resolved. And eligibility criteria, which touched upon earlier by Hannah, in terms of it's not been reviewed in a long time, and it's definitely something that needs to happen, and that potential of looking into a universal opt-in and a universal opt-out, and everyone's opted in. So that's it.
Great stuff. Thank you, Liz. And if you could stop sharing your screen. Just shows the complexity and the barriers built into the system, that, and despite that, things can still be done locally whilst advocating hopefully for those changes and improvements nationally. Thank you, Liz. So Charlotte, Anne and Liz, you just pop your cameras on. We're going to go to some quick questions before moving on to some more case studies. And Charlotte, for you, first of all, if that's okay. So the bean meal project is really interesting. So what do you see as the potential implications in policy making terms based on that evidence of what is possible? And can that model be replicated from a supply perspective? You know, how much supply have we got there? Are there particular implications, I guess, for procurement, for standards and so on, Charlotte?
Yeah, it's a really good question. So thanks to Barbara for asking that one. It was a fantastic learning experience in terms of what is possible and what actually needs to be in place to make these sorts of approaches work. I think it really supports the need for a whole school approach. So it's really key that the food is there, that it's available. So we need to make healthy, nutritious meals available, but doing that on its own is not enough. We also need these educational programs. We need to make it fun, because if it's fun, then most children will generally engage. So it's really thinking about how we can support those sorts of programs like Food for Life and many other fantastic educational programs that we see. We need better support for those programs so they can be sustainable in the long term. We really do need to be looking at supporting public procurement so that it's better able to favour UK grown and locally sustainable produce. So for things like, for example, things like DEFRA's government buying standards for food and catering. This is an interesting upcoming development. This could support scaling up of things like UK grown beans, if it were to be mandated in schools. So I think that's an interesting one to watch. In terms of supply, and so obviously this was a small pilot, but we absolutely need to be thinking about, can we produce enough? So the team at the University of Oxford, who have led the Bean Meals project, have done a lot of modelling, looking at, well, how much could we grow? Just something to say about these beans is they can only really grow in the south and east, so we need to take that into account. The modelling work does show that we could grow enough to support communities to meet nutritional standards for fibre and pulse intake, but then potentially might be some trade-offs in terms of, you know, what if we're using more land to grow beans, then, you know, what are we not growing? So there are always sort of these, what might be displaced. So there's always these trade-offs that we have to think of when we're working in the food system. And then just finally, the point about replication, I think that's a really key point. Obviously, this was a case study in Leicester and Leicestershire, and that's the important next steps for this research. And we're currently working with Oxford Council to look at how these sorts of approaches might be replicated and scaled up in other areas. Thank you.
Lovely. Thank you, Charlotte. A question for you, Anne. Do you have any anecdotal feedback from families or school staff on the benefits of the auto-enrollment approach or the difference this has made to people's lives?
So some of that information we're still gathering as part of our next report that will go to executive with a summary of what we found with the pilot. But certainly information that we've had from some schools, you know, with the potential pupil premium money that they're getting as a result of the pilot scheme. You know, we've got some schools that it's upwards of £40,000 potentially that has been generated through the pilots. If we hadn't have completed the pilot, the school, you know, would have been missing out on that funding potentially. But I think it's also raised a lot of awareness around free school meals for families, certainly with the information around the auto-enrollment pilot that went out on social media. There was lots of families tagging family members in the posts and sort of saying, you know, you might be eligible for this. Have you considered this? Have you looked at this? So I think generally it's increased the awareness of free school meals and how families can access it. But obviously we understand through auto-enrollment that there will be families that struggle with the application process, particularly in Middlesbrough. We've got a very low level reading age of adults, so trying to navigate your way through the system is quite burdensome for some families. So yeah, we'll be certainly gathering a lot of that intelligence and insight from schools and from families as we go over the next few months to generate that next exec report that will be taken in January, February time.
Great stuff. Thanks, Anne. The case studies will be really powerful on this. I'm absolutely convinced. Thank you. And then Liz, have you managed to work with any large supermarkets and food retailers on promoting the scheme? And what's that been like? What's that experience been like so far?
Challenging. So a lot of the larger supermarkets don't necessarily want to get involved in the promotion of Healthy Start. And some supermarkets as well have been challenging in the sense of if you are using your Healthy Start card in that supermarket and you're buying a bigger shop that's greater than the amount of Healthy Start, you have to pay for it in 2 separate payments. So it's a real challenge, and I think it's something that needs to be looked at a national level in terms of encouraging supermarkets to get on board and promote Healthy Start and make it easier for families. Because when we talked about stigma earlier, if you're having to split your shopping when you get to the checkout in terms of what you're going to pay for your Healthy Start card and then pay for the rest in whatever means you can, then that just obviously enhances that stigma, and people are less likely then to use the Healthy Start cards and take up the option of a Healthy Start card.
Thank you, Liz. Liz, I'm going to ask you one more if that's okay. So where are the Healthy Start champions from? And is it voluntary or a paid role? Who manages them? How does that work in practice?
So the voluntary. So initially they were developed to increase awareness within food community spaces, so food banks, food pantries, food supermarkets. And then we've increased it broader now, so anyone can access the training. So they could be professionals, they could work within the community and voluntary sector. So they are kept in touch with they keep in touch with Feed in Liverpool, who contact them on a quarterly basis. But we are looking at developing it further in terms of having kind of application process Healthy Start champions. So ones that might specifically be, for example, in a particular food pantry or in a particular community centre on a Monday at 2 o'clock, who can support people to apply for Healthy Start. But they're all voluntary, but from a range of different backgrounds and workplaces.
Perfect. Thank you, Liz. Thanks everybody for your questions so far. As Beth has put in the chat, we've only got time for a couple to answer right now, but we're going to capture all those questions and try and provide answers for all of them in the post-conference event. But Charlotte, Anne and Liz, thank you so much for your presentations. We're now going to move on to the next set of case studies. So firstly, to Hayley Stafford, who's Business Growth and Development Manager, School and Residential Care Catering at Lancashire County Council, who's going to share a case study on how the County Council is taking steps to improve the school food environment. So Hayley, over to you.
Hello, sorry about that, delay in the unmute. So can you hear me?
Yep, thank you.
Good, okay. Hi, I'm Hayley Stafford. I'm the Business Growth and Development Manager for Lancashire Catering. I've been asked to talk a little bit about my responsibility with Lancashire Catering Service. So I'm responsible for the growth and development of specific business areas, objectives and strategies, including the production and presentation of competitive tenders and business services. So my team is a team of technical professionals who are engaged in the development of food, skills, standards and quality management systems. So just to give you a little bit more information, we've traded on a commercial footing with Lancashire Schools since delegation of the authority function in 2001. We are connected with Soil Association Food for Life, SugarWise Gold Standards, and the service is also accredited to Hospitality Assured Premier status. We hold a primary authority partnership with Preston City Environmental Health also. We are a moral and ethical public sector caterer, always considered where food on our plates come from, how it is made and the standards it is made, grown or reared to. So if we can move on to the next slide. Thank you.
Is that okay, Hayley, for you, the slide?
Yeah, apologies, sorry, I'm
Brilliant.
just trying to get my notes up. I do apologise.
No problem.
For some reason, just bear with me, technical issue here. There we go. So slide 2 is about the background of Lancashire Catering Service. So the delegation of catering budgets and responsibilities was agreed in conjunction with Schools Forum. This resulted in the school kitchen, equipment and all associated budgets passing from the local authority to schools, and the local authority maintained and delivered catering service ceased. At the same time, and following the tender process and the return of services from private contracts, there was a lack of credible market opportunities. So the LA decided to redevelop the catering offering on a commercial basis. The business model considered the new LA catering services financially sustainable, whilst also considering school budgets, economies of scale, and the fact larger schools were more financially viable than smaller schools. In developing a new catering service, it was acknowledged the experience needed to change from the benefits of schools and their pupils. More emphasis was placed around the use of fresh local ingredients, healthier meals, wider choice and more sustainable procurement practices. We can move to slide 3, please. A sustainable procurement policy, whether corporate or service area specific, provides the foundation for delivering broader benefits from public sector spend and can help to deliver cost reduction by improving resource efficiency and reducing waste. Companies can lower their operational costs. Risk mitigation, sustainable practices help minimise legal and reputational risk associated with non-compliance and unethical behaviour. Enhanced brand image, demonstrating a commitment to sustainability can improve companies' reputation and attract environmentally conscious customers. Market opportunities. This is increasing demand for sustainable products. which can open new market opportunities. Along with compliance, adhering to environmental regulations and standards helps ensure compliance and drive improvements. Supplier diversity, promoting sustainable practices can enhance supplier diversity and foster innovation. Environmental impact. Sustainable procurement helps reduce greenhouse gas emissions and conserve natural resources. Social benefit. Supporting ethical labour practices and community development contributes overall all societal well-being. And if we could move to slide 4, please. How does this look for Lancashire Catering? The service aligns to standards which deliver better outcomes for residents and local economy, the environment, the catering service, and also the authority. So you can see here we've got the Solar Association Food for Life served here, which is one of our accreditations, increasing access to healthier food from national policy to local action. Improved food quality ensures that food served is fresh, healthy, and sustainably sourced. Support for local producers encourages the use of locally sourced ingredients, benefiting local economies. Also, UK Farm Assured animal welfare ensures high standards of animal welfare throughout the farming process. Food safety provides assurance that food products meet rigorous safety and quality standards. The Lion brand, as well, associated with the school food map, drastically reduces the presence of salmonella in eggs, making them safe to use and consume. Traceability ensures full traceability of eggs from farm to table, enhancing consumer confidence. Soil Association Organic, environmentally sustainable, higher animal welfare, and eat seasonably, better taste and nutrition. Seasoned produce is fresh, tastier, and more nutritious. Environmental benefits reduces the need for artificial inputs and lowers the carbon footprint of food production. MSC, sustainable seafood. Sustainable fishing practices, ensuring fish populations are maintained at healthy levels and minimise environmental impact. Traceability and transparency. Provide traceability through the supply chain, reducing seafood fraud and ensuring sustainable sourcing. SugarWise Gold standard. This is offering healthy choices to pupils. This certifies products that are low in free sugars, supporting healthier diets. Consumers trust. Provides a trusted mark that helps consumers make informed choices about sugar intake. And primary authority partnerships. Consistent regulatory advice. The catering service receives assured and tailored advice on compliance with environmental health regulations, ensuring consistent and reliable guidance. Improve compliance and efficiency. This partnership helps streamline compliance processes, reduce the risk of non-compliance and associated penalties, and improving overall operational efficiencies. Having local suppliers affords the opportunity to work collaboratively for mutual beneficial outcomes, which align to improving the school food environment. Slide 5, please, the benefits. It would be relatively easy to buy food from anywhere in the world and produce broadly similar meals at lower costs. We would also use more processed convenience foods to reduce labour hours. Both considerations would aid to the bottom line, but as you can see on the screen, this approach would considerably undermine the wider ranging benefits, as well as resulting in school children eating more highly processed foods. Improving school food environments is the only logistic approach to taking and tackling children obesity, climate and environmental impacts, improve welfare standards, and ensure the public money schools receive to pay for meals is spent in a responsible way. Thank you very much.
Thank you, Hayley. That's fantastic and really interesting to see the wide range of food organisations involved as well. Thank you so much. So we're now going to move on to our final case study, which is from Emma Mackey, Food Cumberland Development Officer, Cumberland Council, about their Licence to Grow project. Over to you, Emma.
Thank you very much, Matt. hopefully this is going to work this time. Is that okay?
Great.
Because it wasn't working earlier, so panic over. So I'm here today to talk, to share some information about our licence to grow in Cumberland. The Shadow Authority for Cumberland passed the Right to Food motion in 2022, meaning that food should be available, accessible, adequate, there should be dignity in choice, and people should have access to good food, not just cheap food. And as a council, health and wellbeing is the golden thread across everything that we do. So it was agreed that a partnership approach was required, and we formed the Food Cumberland partnership, working with over 50 partners across the local food system, developing our strategic framework, which takes a whole systems approach to food system changes due to the complexity and interconnectedness of issues that we face. The partnership follows the National Sustainable Food Places framework, and we were awarded our Bronze Award this year for everything that we have achieved so far. So we have 8 subgroups which drive action forward across our local food system. And one of these subgroups is our community food growing subgroup. We work within this group is very varied, and community food growing is becoming increasingly popular across our local area. A big piece of work that we undertook to start with was ensuring best use of formal allotment spaces, and allotments are very popular in the area. So this was across both council and privately owned allotments to ensure more spaces are available for our residents. The group has also been supporting incredible edible sites to be developed across Cumberland and other community growing initiatives as well. We've also been working with the planners to influence local plans and policies, and collaborations are also underway with our healthcare partners to develop growing spaces in healthcare settings. We also work with schools, social housing partners, and within our care homes. So having worked with the communities for a while, it became clear that the process to access council-owned land, which is something we were trying to encourage, was cumbersome and not always clear. We wanted to remove these barriers for our communities, and nationally organisations have been campaigning for a right to grow, which is to allow communities to cultivate publicly owned land. And we decided to develop a process in Cumberland to enable this process to happen. So this would extend access to locally grown healthy food, connect our communities, improve food security, increase health and wellbeing, and enhance biodiversity as well. So we set up a working group with colleagues from a number of departments, and also had community representation to develop a simple licence to allow communities to use our land to grow food. Plots of land can vary from a small flower bed to large parcels of uncultivated land. We've been working with community groups to test the licence process and make amendments where required. We've been working to identify suitable land which was available within the scope of and work within the scope of the agreement, because conditions do apply to ensure the land is maintained and used properly as well. We've also been working with YouthClan to research the impact that this will have on our communities. What was I going to say? We've also been supporting our groups around supporting their volunteers around the funding process, and then we've also once we've been through the process, the council will take a step back and leave the community to enjoy the space that's available. So I'll just quickly talk about our barriers that we've faced, because there have been a few. Even for us as a council, it's been difficult to understand which assets have been available and which ones were appropriate for use in this programme. We've spent a lot of time working across all of our teams and with our communities to identify pieces of land. Property, I have to say, have been really helpful in this case and been working very closely with us. We have come across a few risk-averse colleagues, and we got around this by using our working group to explore possibilities, the benefits, and the fact that the council said health and wellbeing at the heart of everything that we do has been really helpful to sort of talk through all these issues. And one of the asks from the National Right to Grow campaign is that councils will map all available assets and make this publicly available. Unfortunately, we don't have the resources to do this at the moment and to help keep it updated, because it is a mammoth task. However, we've also worked with our groups to identify pieces of land in their local area. Insurance is also a huge barrier for to a right to grow. We were unable to get affordable insurance as an umbrella that the council could hold to cover our community growing groups to deliver activities on our land. And the council self-insuring for our communities was too big a risk that we weren't able to take on, unfortunately. We had hoped to launch this process earlier in the year, but the weather has had other plans for us. So the start of the growing season was delayed, and so some groups felt like it maybe wasn't a great time to start. So we're working with them to launch their sites in spring 2025 instead. And this is kind of a bit of a barrier, depends on the way you look at it, I suppose, but Cumberland has lots of lovely formal parks and gardens, which numerous parties want to protect, and other people want to dig them up and just plant lots of food. So we are working with our Green Spaces team to identify some areas which we could potentially change within our parks and green spaces, which could be used for food growing, to try and have a bit of balance and the best of both. So from this, our key learning, community food growing has been one of the most engaging topics when speaking to our members, and we've worked to find people in other departments who wanted to support the initiative. Most people have been receptive to the idea, and we've developed stronger working relationships across all of our departments as a result of the process. This has been useful for us for other work as well going forward. Developing a working group within property, green spaces, environmental health, public health, legal and our community representation was key to ensuring the licence was appropriate for everyone. When we first drafted a licence, we thought it was appropriate, and we asked for some community groups to give us some feedback. And as a result, the language has all had to be changed, and some of the clauses were also removed to make it more straightforward and accessible for our communities. It's so important to work with our residents on these things and take on board their feedback so everything can work for them. We have also adapted that licence for different sites. One of our first sites was 9 acres, so we didn't exactly start small. And they're looking to develop part of the site for biodiversity improvement, and they want to plant trees. And originally our licence was just for food growing, but given that the size of the site and some of the land wasn't appropriate to be able to plant food on, we've been working with them to allow this activity. So we hope that this concept will increase the access to locally grown food within our communities, and by highlighting the benefits to the community, you get much more buy-in from other people as well. That's all from me. That's a whistle-stop tour. Happy to take any questions.
Lovely, Emma. Thank you very much. Okay, got a couple of questions in the chat for Hayley and Emma. And Hayley, if you're okay, I'll come to you first. So, do you have any key tips or suggestions for local authorities when negotiating procurement contracts to ensure value for money, but also a service that provides quality, nutritious foods?
Hello. Okay, so yeah, the procurement side of things has been complex over the years. We have moved with the way that we approach things. We look more to local suppliers. We benchmark. We look for opportunity to engage more with local suppliers to see what they can offer. We've created a central distribution hub, which is based in Preston, to help with deliveries and supplies. So we now have the opportunity to tender different lots depending on the value and the volume, which then targets local businesses to be able to take a piece of that business that we offer into Lancashire schools. And it gives the opportunity for us to engage more locally without all our eggs being in one basket, as they say. So we like to think that by having these conversations and meeting locally with suppliers, that we can produce better quality food at the right standards. We can work more closely with them with regards to bespoke products for Lancashire catering. And we also can follow the process through our accreditations, that we have our expectations of what we're looking for. And we will continue to work closely with those suppliers to provide the best possible food for our Lancashire children.
Hayley, great, thank you. I had a feeling you were going to get an egg joke in there at some point, so cracking stuff. Hayley, I'm going to come back to you again. What should schools do if they feel they aren't getting the service that was expected of them? What do they do in that situation?
Sorry, can you just broaden more on that question? When you say what schools' expectations, if they're not getting the service from the caterer?
Yeah, what do they do if they're not getting the service they expected to get when they signed up over a longer period of time?
Okay, so contracts change, obviously from local authority to private providers. The benefits are very different. We have a service level agreement. We have our sliding scale of charges. We have those guarantees of training, HR, and we also know that the service that we offer is fair and reasonable with no hidden agendas. The terms and conditions are what they are, and we can reliably say that, you know, that they're going to receive the best possible service with the Lancashire Catering Authority service level agreement.
Thank you, Hayley. Emma, going to come to you. So whose responsibility is it to identify what land is suitable and safe for food growing, and then to do that onward monitoring of use and maintenance of the land and so on?
So we've been working alongside our community groups. So the council has identified pieces of land, working with the community groups who have expressed an interest in our licensing process. And then our working group, which includes members of the community, but also council staff. So we've got a range from property, green spaces, environmental health and public health representation on there. And we sort of take it in turns to check that the sites are still being used appropriately. When we identify sites that might be appropriate, we speak to environmental health to see if there are any issues around, you know, there might be hazards that we as the public might not have been aware of, that other departments might be aware of, to assess whether it is suitable for food growing, because obviously not all sites, some sites might only be suitable for planting some trees or for wildflowers rather than edible food. So we have to be careful around that as well.
Thank you. And then, Emma, I was particularly struck by your comment around risk management and risk-averse colleagues, and I think that's something we all experience across different initiatives. So what's your approach been to addressing some of those colleagues who are more perhaps risk-averse?
I think going in with a very positive mindset and selling all the benefits has been really good for us. Some of our team, a lot of the team who are working on this have been really enthusiastic, and I think you have to obviously take on board what people have flagged as risks and see if there are solutions to how we can work around those, and then kind of bombard them with the benefits of what, you know, there's lots of ifs and buts, but hopefully that won't be the case, and the wider benefits will be so much better than the few possible risks that we sometimes have to take as an authority.
Yeah, thank you, Emma. Is that called love bombing, but in a professional context? Possibly.
Yes.
And then I'm going to come back to both of you, if that's okay. Hayley first. So how have you found the political engagement around this? Has this been an easy journey? Have they all been have they been brought into the vision of these different things, or has it taken work to get the politicians on board? And to Hayley first, please.
Yeah, I think that there has been a lot of work involved. We go back to, and we all mentioned the COVID and the Brexit situation, you know, from a food cost point of view, and trying to provide the best possible service along with the best ingredients is a difficult task. And we continue to look for support. Financially, it's hard. You know, we're having to change things on our menus to accommodate those financial impacts, and we certainly will look for more support going forward with regards to providing a reasonably affordable Lancashire school meal for children across the UK.
Thanks, Hayley. Emma?
I think on the back of the Right to Food motion being passed, the next logical step for us was a version of a right to grow, and they've been really supportive. Our scheme hasn't got huge financial implications for the council, so that's also made it easier. But all the politicians have been trying to help us work with groups in local areas and develop sites, and they've been identifying pieces of, going back to your earlier question, they've been identifying pieces of land as well that they want to see be used. So no, we've been really lucky in that respect.
Great. Thank you, Emma. And can I just say, Hayley and Emma, thank you so much for your presentations. That's been really, really good stuff. We're going to move on now and back to Chris. And Chris, you're going to give us a 5-minute summary of hopefully the discussions we've just had in session 2. Thank you, Chris.
Thanks, Matthew. 5 minutes to cover that. Right, here we go. So the session 2 started with a talk all about taking action at a local level. So with a top line summary that 14% of households in the UK experience food insecurity, and that this is on a continuum. It's not just that people can't access the food, it's that people might go from worrying about affording the food to actively going without a meal to deal with this. And why is this happening? So it's an affordability issue. Some healthy food can be 3 times as expensive as an unhealthy alternative. Accessibility to shops that sell healthy food might not be in your local area. So I think food deserts is what these have been referred to today. There's time and ability to cook fresh meals, but this isn't like the ability, like the skill. It's more about having the time, really, and then the stigma of having to tell someone that you're experiencing this prevents people from reaching out to get help. But just to focus on the fact that this is not an issue of people not understanding that they need to eat healthy food. It's that they physically cannot access it. So in terms of some local action, some examples of projects where we're getting more healthy food into school meals. So there was the Bean Meals project where they developed some UK grown, quick cook and sustainable foods, and then created a whole experience around educating kids and teachers about what these beans are and where they come from, using games and things like that to really engage them, and then show them the beans being produced in loads of different types of meals. Then there was a Urban Green Spaces project where community growers could work together to grow the food themselves and have that closer connection. And these projects kind of embody this joined up approach of researchers working with local governments and working with schools. And then in terms of the case studies, we've got the free school meals in Middlesbrough, which was really an inspiring talk, I think. So using all these different resources and learning from different councils, pulling together all the different members of council to work together from the start and not pulling people in as and when they were needed. And then the end result, and the one I pulled out was just the more like focused, personal, per family number, which I thought was really effective. Saving families £400 per pupil per year. And then onto the Liverpool and increasing the uptake of Healthy Start, where they trying to address the reasons why people weren't reacting to the digital cards. So kind of things like community champions to help explain how to apply and how to get through the application process, having a single point of contact so that people know exactly where to go to get some help. And then some of the targets for the future involve kind of understanding who's actually eligible for the Healthy Start cards and increasing the number of community champions in the areas where they're most effective. And then there was talk from the schools and residential care in Lancashire. So they're talking all about this sort of balance of quality and cost, and trying to make sure that there's food that have good certifications, food standards, sourcing from local producers so that there's less money spent on transport, and improving the quality of the school food environment to reduce childhood obesity in schools. And then finally, the Cumberland License to Grow project, where the local area experiencing this like popularity of growing food, so having to create a license to grow food in local sites. trying to grapple with which properties they can actually use, and this kind of demand for people to know exactly where they all are, have them all mapped out, although that might not be feasible in the near future, but something that people are actually interested in is really interesting. So they're trying to balance local opinion about, trying to balance the people who just want to dig up the local parks to grow food, and then the people who are trying to sort of just protect the local parks. So trying to figure all that out, it was really interesting. Yeah, so that's my 5 minute, hopefully that was 5 minutes, case study summary. I'll hand over to you.
Thank you, Chris. That was fantastic. Some fantastic visuals there, and really helpful summary of the second session. And as Beth put in the chat, we're going to be sharing those summaries shortly on the Conference Hub, but also Beth's put a link in the chat. Chris, thank you so much.
Thank you.
So rapidly moving towards the end of today's conference, just very aware that whilst we've only had time to share 4 case studies during the conference today, we are aware there's so much fantastic work happening across the country to increase access to healthier food. First of all, thank you for everything that everybody's doing, and we're really, really keen to learn from you all, to learn from each other. So the Food Active team wanted to provide an opportunity to share other examples of work with conference delegates to support that shared learning and networking opportunities, and we've therefore collated a range of short case studies focusing on the key learning taken from each area. So we're delighted to be able to launch our virtual case study zone. Examples of some of the fantastic work include mobile food pantries, fruit and vegetable vouchers, affordable food clubs, healthier catering schemes. There's a food insecurity charter in there. There's free breakfast clubs, campaigns to promote fruit and vegetables, and much more. And those case studies can now be accessed via the Food Active Conference Hub, and a link will be shared in the chat and via email post-event. We're also interested in learning if there's other case studies you want to tell us about, so please do share this. So we're welcoming further case studies. We'll keep this open as a live resource, so do get in touch if you want to feature some of the work happening in your teams as well. On behalf of Food Active, I just want to say a huge thanks to all the local authorities and CVS partners who took time to submit a case study and to share some of their learning and reflections within a really sticky food environment with lots of challenges. It's clear to me that the way we will have maximum impact at a local level is by working together and sharing all those key learnings and insights and examples of good practice, and really kind of pushing ourselves to keep on improving the offer we've got at a local level. So I would encourage you to browse through those case studies over lunch if you manage to get a bit of time for lunch, and contact details on all case studies included. So if you'd like to find out more, you can get in touch with those involved. Thank you so much for everybody for submitting. So a few closing remarks from myself before we close the conference. I just want to say thank you so much for everybody who's given us some of your time today. From today's event, I really hope that we've given the new government some food for thought and some useful pointers on how they can better support our communities to access healthier food. And we hope local areas can take away 1 or 2 ideas that may work in the locality and support our residents, who we're here for, to access healthier food through some of those fantastic case studies just mentioned. Thank you to all our speakers for their contributions today and for their time in preparing and delivering the presentations. It really is appreciated. We had over 360 delegates attend today, so thank you so much to all delegates. Thank you for your time. I hope that you found it useful and really appreciate you taking time out of your busy schedules. Thanks for your questions. So we've captured those questions, and we'll try to respond to as many of them as possible on the Conference Hub after the event. The recording and speaker presentations will be equally uploaded to the Conference Hub and circulated with delegates very soon. So, but in the meantime, go and have a look at the virtual case study zone for more examples of great work. And then please do complete the post-event survey that will shortly be circulating. That really allows us to make sure that we're giving everybody what they want and what they need from Food Active, and will help us improve any events going forward. So it's 10 to 1. If you didn't have lunch built in, maybe you've got 10 minutes now just to grab a toilet break and something to eat. And I hope the rest of your day and the rest of the week goes really well. Thank you for joining us. And that's the end of today's event. Thank you.